And is the session open for participants?
I think it should be now.
Okay, let me just do that. Just a minute. Yeah, it's good now.
Okay, amazing. I think we will start this session. So hello, everyone, and welcome to the telemedicine and digital health session on fighting the digital divide. It's lovely to have you all here on this call with us today. My name is Catherine. I am part of the conference organizing team here at the Gwen Youth Hub. And so just to briefly provide an overview of the structure of the session today, this will be a purely moderated panel. Our speakers will be discussing the challenges in the health system integration of telemedicine and digital health tools. So some of these key issues include addressing gaps in the capacity building and also training of health workers to fully leverage the advantages of telemedicine and digital tools in public health, as well as service delivery. And so we welcome the audience to pose any questions throughout the session and to upvote particularly any queries which they may like to hear a response to. And so before we start, I might just briefly introduce our speakers for this panel, Brian Wong, Dr. Onyema Adrabor, and also Karen Daniels. So briefly for Brian, he has been appointed as a youth officer of the Secretariat of the new joint, the Lancet and Financial Times Commission, entitled Growing Up in a Digital World, Governing Health Futures 2030. And so the commission explores the convergence of digital health, artificial intelligence, and other frontier technologies to support achieving universal health coverage by 2030. And particularly, he is also very passionate and greatly interested in the role of governance and youth in governance of health futures and digital health technologies. Brian, would you like to briefly say a few words to our participants?
Sure, yeah, good morning, good afternoon, good evening to everyone, wherever you're tuning in from. So as Catherine mentioned, I'm here in my capacity as youth officer of Governing Health Futures 2030, the Commission. I'm an epidemiologist by training, and I've recently worked during the pandemic for Public Health England as a surveillance epidemiologist. I'd just like to thank the Gwen Youth Hub and conference organizers for inviting me to speak. And I'm honored to be here with such an esteemed group of panelists. I'm really looking forward to the forthcoming discussion.
Thank you so much, Brian. Lovely to have you on this panel as well. Our next speaker is also Dr. Onyema Adrabor. He is a public health professional and technical officer in the Health Workforce Department of the World Health Organization. He has a collective background spanning more than 10 years in clinical medicine and various aspects of public health. His current area of work is focused mainly on the development and coordination of human resources for health policies, norms and standards for strengthening health systems capacity to help countries progress towards universal health coverage. Onyema, if you would also like to say a brief few words as well.
Yeah, thank you, Catherine, for your very generous introduction. And good afternoon to all the panelists and attendees. I'm very, very glad to be here today to share a few words with you. And also, I hope that at some point we would also have some chance to interact and also get your insight, because this is more hopefully of a learning opportunity, and for us to get much out of it by sharing information back and forth with each other. I'm very pleased to be here, and I'm looking forward to the rest of the discussions. Thank you.
Thank you, Onyema. It is also an absolute pleasure to also have you on this panel as well. Last but not least, we also have Karen Daniels. She is a She is a health policy and systems researcher. She worked for nearly 2 decades at the South African Medical Research Council before heading to the WHO and then back again to South Africa. Dr. Daniels is the senior author on a qualitative evidence synthesis, or on health worker experiences of mHealth. Findings from this particular review, along with her longstanding experience of working in a resource-constrained health system, will largely inform her input into today's session. Karen, if I could also get you to say a couple of words to the attendees watching the live stream right now.
I just want to say hello and thank you wherever you are. It's exciting to be here. I know it's a Saturday for everybody, so you probably have other things to do, but I think that we'll have a great discussion. I look forward to challenging questions that push us as panelists so that together we work towards ultimately universal health coverage, whether it be through digital health or other means. So thanks, and very exciting.
Thank you, Karen. And I can imagine no other better way to spend a Saturday than to be on this panel, listening to you speak. And so again, also lovely to have you on this panel. So I think we won't dawdle too much, and we might just dive straight into this panel. Brian, I might turn to you to just briefly set the scene for us. And just to kick us off on this panel. So I've heard that a lot of your work has been focused on youth engagement in the governance of health futures to work towards achieving universal health coverage and the 2030 SDG agenda. So firstly, if you could please share with us what these main goals are and also the role of youth in progressing these initiatives related to digital health and AI.
Yeah, absolutely. Thanks for the question. So I think let's first start by unpacking these goals. So SDG 3, or Sustainable Development Goal 3, is good health and well-being, and that's to ensure healthy lives and promote well-being for all ages. And UHC, which Karen has just mentioned, is about including having all individuals and communities receiving the health services that they need without suffering financial hardship. And that involves this full spectrum of essential quality health services, all the way from health promotion to prevention, treatment, rehab, and all across the life course. And it's really based on this principle that all individuals and communities can have access to quality essential health services. And it's really cross-cutting. It cross-cuts all across different health targets, and it contributes to health security and equality. So you might ask, how do these goals of UHC and SDG 3 relate to digital health and AI? We've seen over the past couple of years how rapidly digital health and AI has been integrated and adopted into health systems around the world. And this is what we refer to as the digital transformations of health. And we're seeing how also digital and internet access and everything that comes with it is also increasingly becoming this determinant of health. It influences other political, commercial, social, and even environmental determinants of health. And decisions taken over these next 10 years up until 2030, including those with regards to these digital transformations across all areas of life, will impact future health and well-being. And that's why 2030 is in this title of the Commission, to really reinforce this timeline of sustainable development goals and primarily universal health coverage, which is a part of the SDGs. So what does this mean for youth? Youth, who we define as children and young people, are growing up amidst this radical digital transformation, these rapidly changing information ecosystems and widespread integration of digital technologies. Not only do our generation comprise the largest youth population in human history, but we're also the most digitally connected. And as the most active users of digital technology and digital media, youth as a generation really represent this unprecedented powerhouse of human potential and digital engagement that can positively transform the future of health and sustainable development. So I'll leave it at that, and I look forward to hearing any other questions.
Yeah, thank you for that, Brian. I think that's a really interesting point that you've brought up, especially with the times that we sort of live in now, COVID, that there has just been this increased reliance on technology, and then also focusing on youth as leaders of that technology. I think that's a really interesting point that you've made. Onyema, I think I might turn to you next for our question. In terms of implementing these sorts of technologies that Brian has sort of briefly touched on, and also training health workers to actually use the technology, what are some of the key issues that you've come across? And how does this affect the scaling and also the democratization of such technologies?
Yeah, so thank you, Catherine, and thank you, Brian. I would like to sort of give you maybe a bit of a preamble, and at the same time try not to talk or duplicate much of what Brian has said, and do permit me to be a little bit philosophical in my approach today, just so that we can think about this in a different way than, say, when we have the policy document or the documents in front of us, which will be shared with you today. So there is a growing gap in the use of technology to deliver healthcare, as well as the learning needs of health professions, students, and workers. And we know that this gap has been exacerbated by the COVID-19 pandemic, both in terms of the need to scale and the ability to resource that scale. Like Brian mentioned, this divide mirrors that of social inequalities, and it is present across countries, settings, economic hierarchies, and age groups. So something that I thought would be interesting for us today was to think about the digital divide in sort of in a different way. And I've heard a lot about the human rights and the ethics argument about the digital divide. So, health and education is a human right, and we deserve this, and we should do something. And I've also heard a lot about the equity, justice, and fairness angle to the argument. But something that really made me think as I was preparing to talk to you today is the idea of a community approach to addressing the digital divide. This is what one of the scholars in this field describes as the networked intelligence. I don't know if you all know Don Tapascott. He's one of the innovative minds out there leading the digital economy and works around that. But this idea is very also related to how technology can help strengthen health workers and both the learning needs and the services they deliver, and how young people can be part of it. And the idea of a networked intelligence is that the digital divide really creates this gulf whereby we are not harnessing the full potential of what we can get. So there is a lot on one side, and it is the idea that we are richer together. I'll tell you a really a short personal story. So recently I went to the hospital to get like a routine checkup, and the doctor told me, "Oh, your thyroid stimulating hormones." I'm sure there's many health workers today on the call, so I hope you know what I'm talking about. And that value was just about borderline high. And I said, okay. So I went home and I thought to myself, he gave me another appointment to do another test to get that confirmed. So I said, okay, it's been a while since I actually read this value for myself. I'm going to see how this, check out the range for Africans. And that blood parameters can vary a little bit. So I was saying, maybe I don't need to do anything. Maybe I fall within what is a normal value for Africans. And I did check a static research article And needless to say, it got me really thinking, because imagine that I had access to, say, this database of interconnected electronic health systems, right? So both from Africa, from Asia, and I can compare across populations, I will be able to, in real time, understand the trend of the values, know whether, I needed to, talk to my doctor, or to just say, I think this is okay. But I didn't have that. Instead, I had like a static research article. Of course, that was done using a number of people in a certain population, but that is static, doesn't allow you to learn much, but also does not allow the richness of all the data and how we're collectively learning to be useful in something that may be as simple as this example. So that is really something that we should be thinking about as a push, that we're better together, that the learning resources and what we're doing to better people's health will be better by the time that everybody is involved and we can extract and learn from each other. So I just will talk to Catherine. Tell me if I'm running out of time. How does this relate to, how does what we're talking to relate to sort of health workers in the modern sense and with a pedagogy framework? Let's take assessments, for example. You would see that today's learning needs to be embedded in real time. It's universal. You can access this from anywhere. It is adaptable, so you don't have a structured textbook or curriculum. You can pick and choose, and that your feedback is real time. So I'm sure many of you have done mocks, and some of these online and learning opportunities that involve technology and the internet, and you see that you have the ability to monitor your trend. You get real-time feedback. You know where you're missing out components, and so on and so forth. Technology also allows you to enhance some of these learning opportunities. And I'm talking a lot about learning today, but it's the same as well on the side of the service delivery. There is a lot of capacity enhancement that technology helps to facilitate multidisciplinary teams, to facilitate coordinated services for patients, and so on and so forth. The digital divide is really important. And I'm just going to also tell you another story. Hopefully I'm quick enough and I'm within my time frame. The labor market is a very important part of how digital and how that digital divide can be bridged, and why it is also important. I'll tell you another story again. Recently, WHO has been trying to develop a vaccine certificate, and if you know very well about the IHR framework, you need the authorized signature of a health worker. So let's scale that back down and say, let's come back down to country level, where countries, some may and some have done so, others not so well, digitalize the health workers and giving sort of unique IDs to those health workers. Now, in the space of a digital vaccine certificate, such IDs, depersonalized, of course, and de-identified, can be part of a strengthened verification process. So you would, with the way things are today, you will find that in many settings, because of data capacity and infrastructure, you would find out that the interpretability of such a tool that could be very important for addressing the pandemic is really weakened. So this is just one of the stories in terms of how this divide can affect some of what we do to promote health. Some of these challenges can be grouped into 4 broad categories, and these are, don't worry about. I won't go into detail. Katrin will share with you some links to some documents where you can read extensively about this. But there are external factors, system level factors, institutional factors, and individual factors that can that are important in determining how wide or how deep, if you like, this divide could be and what could be done to address them. At the external level, you have the subject of leadership. This is really broad. And I don't know how many of you know about Estonia and the case of how they had this president many years ago who pushed for infrastructural investments despite the fact that they didn't have all the resources, but he had the foresight. And we know that today we cannot do digital without infrastructure. Some things must come in that place. There's system level issues about policies. Many countries, we've seen them take the lead. Australia has an excellent roadmap for workforce education. The NHS has 4 institutions that are embedded within its learning system to make sure health workers are prepared. This kind of policies and national level attention needs to be in place before you can see some progress at institutional and individual level. You know, for the poorer systems, and I know I'm beginning to talk about what could be like solutions, you know, relying on open source systems where you don't have to pay is a big way to break that financial barrier. Building your research capacity. We're in the process of developing a research agenda for digital health education that will help to shape, you know, how we learn about the things that we need to put in place to ensure that digital health education and the services aspect become a reality, again, to bridge. So I will maybe stop here and maybe hand over to Katrin, and I expect your questions and some feedback, and you know, let's discuss this together. Over.
Yeah, thank you so much, Onyema. I think that sort of systems and community approach and the way that you look at the problem and also trying to get people and stakeholders from all different sides of the problem to solve this digital divide is a really interesting approach to looking at this issue. Karen, I also might move to you now. You have done a lot of a systematic review that sheds light on the digital divide in both low and middle income countries. So what have been sort of the key gaps in health workers' capacity to use digital tools in public health and service delivery?
Thanks, Catherine. So our systematic review, I mean, it started off with 7,381 studies we reviewed. Out of that, we selected 53, met our inclusion criteria, but we sampled 43 on the basis just of methods. So the ones with the strongest methods. And of those, 32 of the studies came from low and middle income countries, and the health workers who were included were a range so we had 17 studies which had both professional and lay health workers. Then we had 10 which only had lay health workers, and 4 studies in which the participants were only just described as health workers. These studies came from across the world. So 32 of them were from low and middle income countries, or low or middle income countries. and then the rest from high income countries. And what we found is that, you know, that digital health and mHealth, while many people spoke to this as being, you know, of great benefit, both within low and middle income countries as well as within high income countries, health workers were raising challenges to their use of mHealth, and often even within high income countries where the studies were coming from were poorly resourced settings. And so the challenges that are included are things, I mean, Brian spoke to about this generation being, you know, the most technologically connected. But what we found that was for many people, there was a difficulty in being connected. It was from, you know, we had divisions within health worker ranks. So in a rural, one study was in a rural area in South Africa. And while all of the medical staff, meaning medical doctors, had come together and they formed a network and they had phones, they could access it. And so they were getting, you know, easy access. The nursing staff didn't have access. They didn't have their own phones necessarily, and they weren't necessarily using it for work. What we found was that for many health workers, the payment was an issue. So some health workers were actually using, I mean, there's one study that looked at how health workers used their own money to subsidize how, the public health system in effect, because they were using their money to buy airtime, to buy data, etc., because they weren't getting this. There was another study which found that this health worker had a patient who had a psychotic mental health episode, but he ran out of airtime, which is phone time. And he had the phone, but it was on a Sunday and there was no vendor for him to buy the airtime from. And so therefore he had to sit and watch this client until such time as he could actually, so he had the phone, but he couldn't use it. I mean, other issues that have come up have been electricity, network access. You know, there are stories of health workers who are having to go, you know, walk for miles to get to the village because they only have solar panels, and then they have to charge the phone the entire day using the solar panel. And other issues are less infrastructural. There were things such as the fact that you need somebody, you can have a phone, but you need somebody on the other side. You need a strong health system. So if you phone to call an ambulance, that there is an ambulance, because clients don't trust you if you phone and nothing comes, you know, then what was the point of that? So there are many health workers were challenged in many and various different ways, but at the same time, there were also good news stories, such as somebody having to deal with a postpartum hemorrhage and being able to call, people being able to call and get referrals, prescriptions via the phone. But, you know, we have a long way to go in order to build our infrastructure and to recognize that the problems that already existed of poor health systems, of poor infrastructure, of hierarchies within the health system, all of those continue. Other issues, I mean, that came up that we were surprised by were things like language. We assume that, you know, for me, I'm an English speaker, I look at a keyboard, I think nothing. But health workers were saying, well, these keys are not they're not in my language. So I can't, I'm struggling to use it. Other issues that came up, you know, well, it's quite small. And then, of course, where people were managing two dual systems was a big challenge, because they had to do a paper system and they had to do it on the phone. Issues of trust, you know, what do the clients think when they see me? Do they think that I am, you know, investigating them? Things such as surveillance data, when you're using it to collect, that there's a suspicion of health workers. So yeah, they're multiple, it's multifaceted, it's intertwined, and of course there's a lot that is of great benefit, but there's a lot of literacy, health literacy around the use of mobile technology, whether that be tablets or smartphones, and that is needed both within amongst health workers, as well as between health workers and clients. And of course, not forgetting that it's not a magic bullet, because the rest of it enhances. mHealth for us will enhance a good system, but it won't fix a broken system. So thanks, Catherine. I'll leave it at that.
Thank you, Karen. I think that insight was really, really helpful, and especially just to appreciate all of the nuances in terms of the social, infrastructural, and cultural sort of elements that need to come together to actually help us strengthen these health systems through digital technology. And I think that also touches back to what Onyema was also saying with the sort of community health perspective, in terms of getting multiple systems involved into actually solving the problem. So I think just based on that reflection, I think I would like to pose an additional question. This one would be for you all, is what would you identify as sort of some of the key components or key issues that define the appropriateness of these sorts of technologies, particularly in different contexts? So potentially, Karen, I might get you to speak directly to this, since it was very closely linked to your study, and then I might get Onyema to share, and then perhaps Brian can speak next.
Sorry, Catherine. So what are you asking? What are the, if you can just repeat that very briefly?
Yep, of course. So just reflecting on sort of what you've spoken about, how there are so many nuances in trying to understand the problem. What are some of, perhaps from your study, what are some of the key aspects that actually define the appropriateness of a technology to actually be implemented, to actually see the results that you want within a specific community?
Right. So I think that, I mean, there are many issues. Firstly, health workers were saying that they want their managers to be able to understand, because they said that if their managers didn't understand, then they thought that they were just, kind of, that this wasn't real work. So they want their managers on board. Political commitment will be a big issue because the infrastructure costs. Having the technological backup, health workers spoke about that. They needed to have both colleagues as well as some kind of team that they could refer to when they didn't know, considering cultural issues, looking at the network capacity, giving people proper phones. So in some of the studies, people had broken phones because these are project phones and they're going, from somewhere else to LMICs, so they're kind of getting dumped with the junk phones. Well, actually, give the people, and then also what would make it work is people that understand. So the health system being able to back up the technology. If I pick up the phone to phone for an ambulance must arrive. If a health worker picks up a phone to phone a senior colleague to get advice in order to give some kind of telemedicine, then there must be a senior person to actually answer that phone. And they must be willing to give their advice, and then that starts to work. Once those things are in, once we have that in place, and of course the support through infrastructure, the looking at access to data. So for example, Onyema had his own personal story earlier, but I had in 2012 went to, so I live in Cape Town, where we have a gigantic problem. Data is extremely expensive in South Africa. And so you can't get, you don't get data everywhere. You have it in your house if you're lucky. but a lot of people don't actually have access. When I was in Norway with my son in 2012, and he was still quite young, he was going on his phone all of the time. And I was like, how are you getting this right? And he said, because there's Wi-Fi everywhere. So that is where high income countries, have, they have the advantage over LMICs where data is extremely expensive. And now in COVID, we're having a push around intellectual property rights. Well, can we have a push around access to data for everyone? So universal health care. Brian raised health and digital health being, and digital access. So can we push to get data for digital health for everybody? That I think, so those are some of the things that I think, and I think certainly youth, can push towards it. And I think youth can also support older health workers. That came up often in our studies, that older health workers felt that they were, that they lacked the capacity and they needed to rely on younger colleagues to actually, their children often they were asking, but if you're there, help them, form a bond. Anyway, thanks.
Thank you so much, Karen. And I think we might also turn the question to Onyema. So Onyema, from your experiences as well, what would you define as some of the key components that sort of indicate the appropriateness of certain technologies for the context and the communities that they're meant to assist? And if I also may, there has been a question come through from the chat to ask about, from your perspective, especially with the systems and community approach thinking, would the international sharing of medical databases eventually lead to the universalization or standardization of healthcare, or would it lead to a physician to sort of ignore their own country's specialized needs or treatment plans? And so if you could also speak to that in your answer, if that's possible as well. Onyema?
Yeah, thank you, Catherine, and thank you, Karen. These are really excellent thoughts and questions. So I'm going to add to Karen's answers and perhaps pass it on to Brian as well. So one thing that a digital technology is a really fast-paced environment, and it's moving swiftly, much faster than we can assess. And one thing I would add to that in my experience, in just looking around, is do we implement these technologies with evidence? So now I'm talking about education technology assessment. So how effective is one, for instance, how effective is one form of learning over the other? How effective is learning through the mobile phone, better than, say, using virtual reality, for instance, right? These questions are probably context specific, are probably specific for health professions within the different occupations and student learning groups, and we need to, and digital technology is great, but as much as we need to adapt and take advantage, we need to also ensure that we are on top of the evidence, knowing what works, knowing what doesn't work, so that we can deploy this and maximize learning needs. And just to quickly, so another aspect is, and I'm happy Brian is on the call, will probably speak to that, is youth can also influence a policy and the regulatory sort of dimensions around how digital technology is used for service, but also for learning. It will be weird to kind of talk about, advanced, VR and some kind of things, whereas you're sort of issuing paper licenses and, you're mailing memos around the country because you don't have, say, established databases or up-to-date regulatory frameworks that actually look at, digital certificates, talk about portability of learning certificates. If I'm trained here, what does it mean for this client, especially if, I don't know, maybe the course I took was developed somewhere in the East. These kind of questions need the policies to match them. And I think, like Karen said and Brian said earlier, this generation of the digital natives, the youth, are the ones who are more likely to think about this and to make sure that the policies are cognizant and can take advantage of some of these things. To answer the question on the chat, will sort of like an agglomeration of global databases lead to physicians to ignore their own thing? I don't think so, but it links back very clearly to what I was just talking about in terms of what are the governance measures around such interlinkages. How will the data be used? Who will contribute to them? How would I, if I'm a physician or a physiotherapist or a pharmacist, I'm more likely to use that for the benefit of my patient or the population that I'm attending to. But like I was alluding to at the beginning, medicine and health is becoming very personalized, including the learning and the way that it comes to the learner. So you have, one good thing about it can be you have this big database and sort of resource if you get access to it, and if countries can agree amongst each other, it's a rich pool. At the same time, there are still health professions are still guided by clinical guidelines and licensure sort of procedures that will keep them grounded. I hope that maybe helps to explain that in a bit. And we like to see, I think the question on telemedicine being a specialty, we like to see technology as an enabler. So I don't think that telemedicine in itself will become a specialty per se. All specialties need some form of technological integration. But however, we know that if you're doing some Da Vinci robotic surgery, for instance, you probably need some real specialized skills, much more than a lot of the other general surgeons will have. But we like to see technology cut across the specialties and the professions, both in terms of the services they offer and the way that they learn. Over.
Yeah, thanks so much for that, Onyema. And I might pass it on now to Brian as well. So Brian, just to repose the question, what do you sort of define as the key aspects that sort of almost predict whether the piece of technology that you're trying to enact will actually be properly appropriate for both the community and also the purpose that you're trying to sort of enact through, is what Onyema sort of said, technology as a tool.
Yeah, thanks, Catherine. So I think I'll start by saying, for years, digital health has often been touted as this great equalizer. And while there's no doubt that digital technologies are a powerful tool to bridge digital divides and overcome entrenched disparities in health systems, I think it's really important to remember that as Onyema said, it's an enabler, not a solution in and of its own. And sometimes digital isn't even necessarily the best solution. Karen and Onyema have already highlighted various issues with respect to digital health implementation. I'm not going to reiterate these, so I really want to bring the focus back to youth. Now, today's youth are experiencing really unique challenges that have implications on health and well-being. These have been really highlighted by the COVID-19 pandemic, which has shown these detrimental and disproportionate impacts, whether it's upended education, increased mental and physical health concerns, lack of job prospects. Onyema's touched on the health workforce. These are really crucial stages and crucial factors, and I think these have impacted and really disrupted future trajectories, but have also led to this exacerbation of existing health inequities and widening of digital divides, which Onyema has nicely defined for us. I'd also like to emphasize that this isn't just between high-income countries and low middle-income countries, but also within countries, as Karen has highlighted, through urban and rural divides, and I've seen it even myself in the UK, where I'm dialing in from, with lower socioeconomic households with limited broadband access or even number of devices, who's prioritized for those devices or for that connection. And I'd like to highlight that I think it's really concerning that countries with these most youthful populations in the world are facing this double disadvantage of weak health systems as well as low access to digital technologies. Now, I'd like to link this back to my work with the Commission, which acknowledges that digital and data tools are already being incorporated into the design of health systems, but we want to highlight that this happens inequitably and in absence of global governance. And we think that this poses a really detrimental risk to human rights and health equity, both today and in the long run. And that's why we focused on young people and future generations to really highlight these long-lasting implications. So we've asked questions, like how will health futures be shaped by these technologies, and what groundworks must we lay now so that we really safeguard future generations against potential human rights and equity risks. So growing up in this digital world really implies this future impact on these generations, and youth are really considered in every aspect of the Commission's work, and we've really made these concrete efforts to foster online and offline exchanges with youth. I'd just like to talk about some really good strategies that we've kind of heard about and have come about in our work. One of them is this term meaningful engagement, which we hear tossed around a lot. And I think when we're designing and implementing initiatives, particularly for young people, it's really important to ask who's it really meaningful for, and what medium or form of engagement is most effectively going to allow young people to benefit from these opportunities, but also to drive the changes themselves. And I think when designing initiatives, it's really important to remember that young people are experts on their own health needs, the technologies that they use, as well as how they access information. And I'd like to emphasize, the importance of using this participatory methodology, which we really employ in the Commission and in our work, in which young people are actively and intentionally involved in every process of planning, development, implementation of solutions as co-creators, collaborators, problem solvers, champions, and change agents. And linking back to our work, a really central tenet is steering clear of tokenism and towards more integrated systems of involving youth. And earlier this year, we hosted a youth consultation, which was titled, "What do youth want to see in the future of health governance?" And the aims of this consultation were first to hear from youth how they identified as a group. Do they really identify as a digital generation or digital natives? Do they like these labels? Second, really to understand what concerns they had and what proposed solutions they have with respect to these digital transformations in health we've been discussing. And finally, to provide the space for our commissioners to hear from the youth on the types of health features that they want. And I'm pleased to say that, as a result of this, we were able to co-create this youth statement and youth call for action, which we'll be sharing alongside the commission report later on this year in September. And I'll also just quickly take this opportunity to plug our youth network, which was launched by our co-chair, Ilona Kickbush at last month's EcoSoft Youth Forum, and would like to encourage young people in the audience everywhere to join this network, and I'll drop the link in the chat later on.
Thank you so much, Brian. And I think that sort of overview about youth being clear and being experts on what community health is like for them and for youth specifically, I think that's such an important point as well, just to sort of bring that leadership and that onus back onto youth, which, as you said at the very beginning, are one of the most powerful sort of stakeholders and groups of people who can lead also in terms of trying to close the digital divide and also use technology to solve a lot of healthcare's problems. So thank you so much for those reflections. And I think I might just pose one final question since we are slowly coming to an end. So I'll pose this to all of our panelists here today, just to close the session off. So during the first day of our conference, we spoke a lot about the opportunities for youth advocacy and more universalized access to education with online learning. And so sort of reflecting on those ideas and also what we have discussed today in this particular session, what are the opportunities that you think that the pandemic has also brought up to enable better access to healthcare through digital technology? I might get Karen to speak first, Onyema, and then Brian to close us off.
Hi, Catherine. So I think, well, firstly, I'm not a youth. And I wouldn't want to speak on behalf of youth. And I really value and recognize what Brian has been saying about the fact that youth know. And I think that for me is the starting point, is that with due respect to people of our generation, we do offer something, but I think that, that the youth are the next generation. They are the ones who are going to be, practicing health in 20 years, in 30 years time. And that for me is the first thing, is that we have to listen to youth. We have to ask youth who have, in the midst of the pandemic, been thrown into digital learning, what they really think, how this has really been for them, because there is all of this promise and there have been lots of things. And so I have a son who is 22 years old and who is, I would be regarded as youth. He is at university. And in some respects, it's been great. He has been able to, rather than go straight into a class, being able to, study be in two different countries and study. But at the same time, he's found it incredibly stressful, because he misses human interaction. He misses being in a classroom, talking to his friends. So for me, there are opportunities in terms of mobility, in terms of access, but again, there are also challenges. And I would not want to speak on behalf of youth to say what it is, that, what it is and what the way forward should be. For me, the opportunity is to hear youth, to hear what you have to say, to make your mark, use your experience, but also use digital technology for activism. It is a new site. It's a site that did not exist. For me, when I was growing up, activism meant that you went to the streets. Digital technology are your streets. So use them for what you need. Thanks.
Thank you so much, Karen. That is extremely encouraging to hear those words from you. And so, Onyema, I think I might pass the baton on to you to sort of address what you think are sort of the opportunities that have arisen in terms of the ability for digital health technologies to solve some of healthcare's major problems now.
Thank you, Catherine. I'm going to be very brief, hopefully, and also like Karen, I'm going to devolve the part to Brian. But I think again, borrowing a leaf, the pandemic did really, digital was there before the pandemic, but the pandemic really accelerated the need for digital. But one thing that we know, and we're getting anecdotal evidence, is that um, you cannot substitute human interaction. And people, whether it's Zoom fatigue, you've seen companies in the private sector, declare Zoom free days, Zoom holidays, and this kind of stuff, because there needs to be a balance. There needs to be a balance. As much as learning is also becoming, more personalized, you do it at your own pace. There is a critical aspect for health workers, which is in the aspect of interprofessional education. So as much as digital did open a lot of opportunities, we're seeing where we need to start thinking about how to bring in other, we are a profession of, we deliver what we do by teamwork. Doctors work with the nurses, with the physiotherapists, the clerk needs to do their job. So we need to learn together. And the shift towards personalized learning and doing at your pace and sort of tailor-made learning can really crack some of these webs that we need to bring together. So I will leave that and probably hand over to Brian to just share how you can help us solve some of this.
Thank you, Onyema, for those insights. As you mentioned, that we might turn to Brian now to share some of his thoughts on what opportunities the pandemic has brought for youth in terms of using and harnessing digital technology to solve some of our problems in healthcare. Brian, if you could speak to that.
Yeah, absolutely. Thanks for the question. And to conclude, I'll just say, with online work and education becoming this new norm, as Karen's mentioned, this COVID's really heightened the need for developing digital skills. But it's also revealed and amplified these existing disparities in digital access and skills. So amidst these challenges that have been presented, we've really seen how youth have demonstrated innovation and resilience to harness their digital expertise to build community, as well as to remain connected and creative throughout the pandemic, but also to simultaneously advocate for improved health features. Now, digital transformations really offer amazing opportunities for improved health and well-being outcomes, but not only do they improve access to services and information, but they also create new opportunities for communication, learning, self-expression, and civic participation. So I think youth can and already have adapted to a lot of these changes, through upskilling and capacity building, through developing digital and health and civic literacy and skills to really safely and confidently navigate digital environments and take control of their personal data. But I think, also it has helped us, youth have also, they really should, continue to get this better understanding of processes which govern health and specifically digital health technologies. So in our work with youth, a lot of my peers have raised significant questions and concerns about these, broader digital implications. So, privacy, trust, ownership, accountability, and even, equitable access. So I think youth should really continue to lobby policymakers, as Karen's mentioned, really let them know and other key stakeholders know what we want and that we can and should be a part of these solutions. We can co-create these innovative solutions to governance, as well as co-govern these digital transformations in health as well. I'll end there. Thanks.
Thank you so much, Brian. And I think that was some really valuable insight that almost ties back as well with what Onyema was saying earlier about that systems and community approach of thinking, and also just the importance of involving youth in these conversations. I think that's such a pivotal point, particularly for our discussion today. Unfortunately, we do have to end it there. So the links to all of the readings and further information that have been mentioned by our lovely panelists today will all be included in the chat. So you should see them appear quite soon. Please feel free to access those resources and to read more about those. And following this session, we'll go to a 45-minute break. We'll resume with a session on youth success stories at 2:45 p.m. GMT. Onyema, Brian, and Karen, thank you so much for being on this panel. It was an absolute pleasure to be discussing these issues with you today. And thank you so much. I really learned so much personally, so I would really like to thank all three of you for that. And so with that, I think we might go to the break now for everyone. So thank you so much for joining and being with us here on this panel today.
Thanks, great pleasure, Catherine. Bye to everybody.
Thank you, my absolute pleasure. Bye-bye, everyone.
Health and care workers. They protect us when we need it most. When our world shuts down, they go to work. They fight for the lives of our loved ones and comfort them when we can't, day after day, often without proper protective equipment. Despite fear and fatigue, and against overwhelming odds. They never asked to be heroes, but the efforts we applaud are heroic. Health and care workers have died by the thousands protecting us from COVID-19, so applause without action just isn't good enough anymore. Now, it's our turn to protect them. Too many are underpaid and overworked, without the resources to do their jobs safely. Too many face stress, trauma, and burnout without adequate mental health support. Most health and care workers are women, but few are in positions of leadership. All of this needs to change. Now, more than ever, we need to invest in skills, education, and decent jobs, in safe working conditions, and in policies that retain health workers, protect their rights, and support gender equality. This investment can heal our societies and rebuild our economies. But it's an investment that requires all of us, together, across sectors, professions, and politics. The time to act is now. Invest in health systems. But most of all, invest in the people who are the world's health and care workers.
branché dans les sentiers Cosette.
What does health mean to you? For many people, it is the foundation to do the things in life they love, to enjoy the company of others, to work, to play, to learn, to laugh. Health is life. So many people have lost their health in the past year, but they have lost so much more: their jobs, their ability to see their families, to travel, to live life. And more than 2.7 million of our sisters and brothers have lost their lives, and we have lost them. The hard truth is that some of those people died simply because they could not get the care they needed because of where they live or how much they earn. Inequality is not a new problem, but COVID-19 has brought it into sharp focus. The pandemic has pushed an estimated 120 million people into extreme poverty. It has significantly increased gender inequalities, with more women than men leaving the labor force. And as we speak, rich countries are vaccinating their populations while the world's poor watch and wait. Health inequalities are not just unfair, they make the world less safe and less sustainable. So, as they build back from COVID-19, it's vital for all governments to invest in better health services and remove the barriers that prevent so many people from using them, so more people have the chance to live healthy lives. This World Health Day, we're calling on you to use your voice and your vote for a fairer, healthier world.
One year ago, world leaders launched a global solution to rapidly end the pandemic and equip countries to fight this devastating virus. The ACT Accelerator has secured more than 60 million COVID-19 tests, over $500 million worth of equipment to keep health workers safe, and nearly 3 million doses of the proven COVID-19 treatment, dexamethasone. COVAX has delivered more than 40 million vaccines to over 100 countries and economies, and ACT Accelerator supported research continues to find the next generation of tools. But the pandemic isn't over. Societies and economies are still suffering. Our safety and security is still at risk. And history is still in the making. It's time to recommit to act together. Let's take research, production, and distribution up a gear to keep everyone, everywhere, safe from COVID-19.
Health workers. They're more powerful than you think. They're on the ground, on call, and on hand, behind curtains and inside labs, from the very start to the very end, preventing illness, defeating disease, and saving lives. Every second is spent fighting the unpredictable and defending against the unimaginable, wherever they are, from dawn till dawn. But their power doesn't stop there. They get people back on their feet and back to work. They keep businesses succeeding and economies growing. The health sector is the fastest growing source of jobs and will keep the world moving towards the Sustainable Development Goals. But to unlock their true power, we must act now. As populations grow and change, the world is facing a shortfall of 18 million health workers by 2030. In March 2016, the United Nations Secretary General appointed the High-Level Commission on Health Employment and Economic Growth to create a plan. We need to invest in education and jobs to tackle countries' changing needs. We need political support and bold policies, with cooperation nationally and internationally. And we need to see health workers no longer as a cost, but as an investment in a healthier, fairer, and more prosperous future. It's time to transform the global health workforce by making greater investments to stimulate job creation, addressing gender inequality and maximizing the participation of women in healthcare, expanding and improving education and lifelong training by focusing on skills, pushing health services towards achieving universal health coverage by focusing on people, not diseases, integrating new technologies into the education and practice of health workers, equipping health workers to respond effectively to emergencies and ensuring their safety, raising adequate funding from multiple sources to build the health workforce, cooperating across countries and sectors to ensure the global supply of health workers grows sustainably, guaranteeing that when health workers migrate, it benefits the countries they come from and the ones they go to, and that their rights are protected. And collecting better data, measuring results, and making everybody accountable for action. Together, we can unleash the power of health workers. It's an opportunity we can't afford to miss.
In the darkness, I thought I would never see light again.
My heart stopped. A lifetime of risks that could have been avoided.
In my time, I have seen too much sadness. My mother, my brother, my son, one by one they fell sick, and they were all gone. But I am here. I have survived. I'm here to give people the best care that I can.
Today I get a second chance. Today is the day my life begins.
I will be there for this child and care for her as she grows.
I will do all within my powers to help my little girl make healthy choices.
I will join the fight. I will spread the word, making sure we are prepared and strong. I can see things starting to change. There are still many challenges, but I know I'm making a difference.
I will teach my daughter to treasure life. and I will be there.
Today, I have hope. There will be light again. I am 1 in a billion.
I am 1 in a billion.
I am 1 in a billion. Imagine a billion more.
Health workers. They're more powerful than you think. They're on the ground, on call, and on hand, behind curtains and inside labs, from the very start to the very end, preventing illness, defeating disease, and saving lives. Every second is spent fighting the unpredictable and defending against the unimaginable, wherever they are, from dawn till dawn. But their power doesn't stop there. They get people back on their feet and back to work. They keep businesses succeeding and economies growing. The health sector is the fastest growing source of jobs and will keep the world moving towards the Sustainable Development Goals. But to unlock their true power, we must act now. As populations grow and change, the world is facing a shortfall of 18 million health workers by 2030. In March 2016, the United Nations Secretary General appointed the High-Level Commission on Health Employment and Economic Growth to create a plan. We need to invest in education and jobs to tackle countries' changing needs. We need political support and bold policies, with cooperation nationally and internationally. And we need to see health workers no longer as a cost, but as an investment in a healthier, fairer, and more prosperous future. It's time to transform the global health workforce by making greater investments to stimulate job creation, addressing gender inequality and maximizing the participation of women in healthcare, expanding and improving education and lifelong training by focusing on skills, pushing health services towards achieving universal health coverage by focusing on people, not diseases, integrating new technologies into the education and practice of health workers, equipping health workers to respond effectively to emergencies and ensuring their safety, raising adequate funding from multiple sources to build the health workforce, cooperating across countries and sectors to ensure the global supply of health workers grows sustainably, guaranteeing that when health workers migrate, it benefits the countries they come from and the ones they go to, and that their rights are protected. And collecting better data, measuring results, and making everybody accountable for action. Together, we can unleash the power of health workers. It's an opportunity we can't afford to miss.
We are at a crossroads. The fight against non-communicable diseases is one of the greatest health challenges we face today, forcing us to make critical choices. Do we take the road to healthier future by protecting people from tobacco and other health-threatening products, improving detection and screening for conditions like cancer, heart disease, and other NCDs, providing healthcare for all, and ensuring people are well enough to work and support their families? Or do we continue down the same uneven path, where too many people needlessly suffer from NCDs? where 15 million men and women aged 30 to 70 die each year from a heart attack, stroke, cancer, diabetes, or asthma. Most in poor, vulnerable countries, and where countries use valuable resources yet miss opportunities for sustainable development. We are here because we all agree we can stay on that path. We must take the same road together to beat avoidable NCDs. Next year, we will meet at the UN General Assembly high-level meeting on NCDs. This meeting will generate momentum towards achieving the Sustainable Development Goal target of reducing premature deaths from NCDs by 1/3 by 2030. But to make progress, political choices must be taken on a dramatically different scale. We must implement life-saving NCD best buys, increase financing for NCD action for critical needs, like affordable insulin for diabetics, increase taxes on tobacco and other harmful products, stand up to industry pressure, promote physical activity through media campaigns, and better design cities. The Montevideo Roadmap identifies the many challenges the world faces to meeting NCD's targets. It offers solutions to overcome these barriers and promote healthy futures for all. It urges greater coherence between health and other public policies, including trade, environment, and education. It places greater emphasis on the role of NGOs, the private sector, philanthropies, and academia. And it shows that action on NCDs is essential for sustainable development in all countries, and their capacity to make bold political choices for health in the face of commercial interests. To accelerate action to save lives and strengthen our societies, and beat NCDs once and for all.
Wherever you live, your health is impacted by the environment. Around the world, more than 50 million people die every year from disease, and nearly 1/4 of those deaths are directly caused by environmental factors. Can you imagine? That's 1,400 deaths every hour of every day from an unhealthy environment. The hardest hit are those in low and middle income countries, especially in Africa, Southeast Asia, and the Western Pacific, and the young and old are most severely affected. More than half the world live in urban areas and can face heavy traffic, air pollution, poor housing, and limited access to clean water and sanitation. Many work in the informal sector under dangerous, dirty, and demeaning conditions. We all face the impact of chemicals and poisons, radiation, and poor farming practices. And climate change means a very uncertain future. So now we are at a crossroads. Things can continue getting worse, or we can work together to improve our world. Simple measures can be taken immediately to protect our health and the environment. We can reduce our consumption and clean our air by using sustainable fuels and walking or cycling more. We can safely store toxic substances in our homes and workplaces. We can protect our water resources by disposing of waste appropriately and introduce clean energy technologies. We can bring multiple government sectors together to ensure all policies actively support health. Let us all work together to improve our health and well-being.
This is Amala. She was born only a few hours ago and has a serious blood infection called septicemia. You would think that antibiotics would work for her infection, but we are finding more and more cases where antibiotics can't kill some bacteria. Antibiotics cure infections, but for years we have taken too many of them, and often for the flu or a common cold for which they do not work. This has made many bacteria resistant, which means that antibiotics will no longer work. Unfortunately, the overuse and misuse of antibiotics are making bacteria grow stronger and resistant to antibiotics, and there are few antibiotics being developed. What can you do? Always seek the advice of a healthcare professional before taking antibiotics. Only take antibiotics when you have a prescription and do not self-medicate. Also, wash your hands and practice good hygiene at home and in hospitals to prevent bacterial infections in the first place. Thankfully, Amala didn't have a resistant bacterial infection, and the antibiotics prescribed by the doctor worked, and she recovered from an infection that could have killed her. We must act together to make sure that our antibiotics remain effective for when you and your children need them. Antibiotics are a precious lifesaver, so let's handle them with care.
The word pandemic comes from, two words, pan, demos. Demos means the people and pan means everyone. Pandemos means, in effect, a pandemic is affecting everybody on the planet. But we can end the pandemic as a tragedy by stopping the deaths, by stopping the hospitalizations, and we have the power to do that. Vaccines give us the power to do that. The problem is, those vaccines are not in the right places, and they're not going into the right people. 85% of all the vaccines are going into high-income countries. Half the world's population effectively does not have access to these vaccines. Vaccines are a global good. They're something that we should distribute on the basis of need, on the basis of the benefit that people derive. If we could just move to distributing vaccines in a slightly fairer way, we can stop the deaths. We can stop the tragedy associated with this pandemic. We can do something now. I'd ask all of you out there, think about this. We need to use vaccines in a much fairer and much more equitable way. This is a test of us as a people globally. Are we prepared to protect the most vulnerable and to stop the death?
Every day throughout your life, whoever you are, wherever you live in the World Health Organization is working to protect your most precious possession, your health. Promoting a healthy diet, regular exercise, and health checks to prevent diabetes, cancer, and heart disease. Monitoring how your children are growing, advising what they need to thrive, and what to do when they get sick. Recommending safe and effective vaccinations to keep the family healthy, and helping countries assure everyone receives the immunizations they need. Promoting access to safe, modern contraceptives and information on sexual health. Keeping your food safe to eat and water safe to drink. Increasing seatbelt and helmet use to save lives on the roads. Helping countries improve the quality of the air you breathe and tackle climate change. Promoting good mental health services and support, particularly for vulnerable people. Keeping you informed about health risks and how to protect yourself at home, at work, and while traveling. Understanding and planning for the specific needs of people at different ages and stages. Older people, adolescents, and people with disabilities. Fighting against deadly habits like tobacco use. Protecting people from malaria, HIV, tuberculosis, and other infectious diseases with quality diagnostic tests, medicines, and preventative tools like bed nets. Preventing infections in health facilities and tackling drug resistance to ensure that medicines will continue to work. Assuring quality care for mothers and their babies before, during, and after childbirth. Vaccinating newborns against diseases like hepatitis B, access to safe blood if needed, and support to ensure your baby thrives and grows through childhood and adolescence to be a happy and healthy adult. Tracking health trends and helping countries to prepare for and respond rapidly to health emergencies. Sending in experts, medicines, equipment, and supplies when disaster strikes. Helping countries to provide quality health services designed around and for people, with skilled health workers, innovative, safe, and affordable medicines, vaccinations, and other medical products, backed by the latest scientific recommendations and health information, while protecting people from catastrophic health bills. So no one has to choose between spending on health and other essentials like food and education. Every day, the World Health Organization is working with you to promote health, keep the world safe, and serve the vulnerable.
I had a black dog. His name was Depression. Whenever the black dog made an appearance, I felt empty and life just seemed to slow down. He could surprise me with a visit for no reason or occasion. The black dog made me look and feel older than my years. When the rest of the world seemed to be enjoying life, I could only see it through the black dog. Activities that usually brought me pleasure suddenly ceased to. He liked to ruin my appetite. He chewed up my memory and my ability to concentrate. Doing anything or going anywhere with the black dog required superhuman strength. At social occasions, he'd sniff out what confidence I had and chase it away. My biggest fear was being found out. I worried that people would judge me. Because of the shame and stigma of the black dog, I was constantly worried that I'd be found out. So I invested vast amounts of energy into covering him up. Keeping up an emotional lie is exhausting. Black dog could make me think and say negative things. He could make me irritable and difficult to be around. He would take my love and bury my intimacy. He loved nothing more than to wake me up with highly repetitive and negative thinking. He also liked to remind me how exhausted I was going to be the next day. Having a black dog in your life isn't so much about feeling a bit down, sad or blue. At its worst, it's about being devoid of feeling altogether. As I got older, the black dog got bigger and he started hanging around all the time. I'd chase him off with whatever I thought might send him running. But more often than not, he'd come out on top. Going down became easier than getting up again. So I became rather good at self-medication, which never really helped. Eventually, I felt totally isolated from everything and everyone. The black dog had finally succeeded in hijacking my life. When you lose all joy in life, you can begin to question what the point of it is. Thankfully, this was the time that I sought professional help. This was my first step towards recovery and a major turning point in my life. I learned that it doesn't matter who you are, the black dog affects millions and millions of people. It is an equal opportunity mongrel. I also learned that there was no silver bullet or magic pill. Medication can help some, and others might need a different approach altogether. I also learned that being emotionally genuine and authentic to those who are close to you can be an absolute game changer. Most importantly, I learned not to be afraid of the black dog, and I taught him a few new tricks of my own. The more tired and stressed you are, the louder he barks, so it's important to learn how to quiet your mind. It's been clinically proven that regular exercise can be as effective for treating mild to moderate depression as antidepressants, so go for a walk or a run and leave the mutt behind. Keep a mood journal. Getting your thoughts on paper can be cathartic and often insightful. Also keep track of the things that you have to be grateful for. The most important thing to remember is that no matter how bad it gets, if you take the right steps, talk to the right people, black dog days can and will pass. I wouldn't say that I'm grateful for the black dog, but he's been an incredible teacher. He forced me to reevaluate and simplify my life. I learnt that rather than running away from my problems, it's better to embrace them. The black dog may always be part of my life, but he'll never be the beast that he was. We have an understanding. I've learned through knowledge, patience, discipline and humour, the worst black dog can be made to heal. If you're in difficulty, never be afraid to ask for help. There is absolutely no shame in doing so. The only shame is missing out on life.
We live in a world beating with urgency, breathing with difficulty, breaking under necessity. We are a society consumed by technology, compact in proximity, choked by inactivity. We are global, we are responsible, we are trending, we are too inactive. Everyone, everywhere, every day. We have a plan. It's time to activate our governments, to activate our environments, to activate our society, to activate ourselves. It's time to activate movement, to activate improvement, to reverse our direction, to activate new trends. We need to alert you. We need to activate. Everyone, everywhere, every day.
We live in a world where undernutrition and obesity can exist side by side in the same country, home, or even person. Foods high in sugars, salt, and/or unhealthy fats are leading to unhealthy diets and are one reason why children may not be growing healthily, while causing other people to develop overweight or obesity. The consumption of unhealthy diets is heavily influenced by marketing. Easy access is fueling this new nutrition reality, but thankfully, change towards a healthier future is possible. By having a sustainable healthy diet made up of a variety of foods that are safe for consumption, we can promote health and have better abilities to fight illness. How do we do this? Good nutrition for women during pregnancy and for children in their first 1,000 days of life, including breastfeeding, sets them up for healthy adulthood and future generations. we should eat more fresh fruits and vegetables, whole grains, pulses, nuts and seeds, and less the food industry will be encouraged to produce foods that contribute to healthy diets. We can also call on our leaders to make the right decisions so that every person, everywhere, can afford and access good nutrition. When people like you and me, industries and governments work together to make positive changes, we can create a healthier world.
Developing a vaccine is a long road full of checkpoints. Different phases of testing are designed to make sure it is both effective and safe. But with the whole world struggling to contain a pandemic and unprecedented amounts of scientific work taking place, the road to finding the COVID-19 vaccine looks more like this. But first, let's take a look at the usual path. During preclinical trials, the vaccine is tested on animals to determine whether they develop antibodies to the disease-causing germ. If these trials are successful, the candidate vaccine moves on to phase 1 trials in humans, during which the vaccine is given to a small number of healthy adults to assess its safety in humans. The results of every phase are reviewed by independent clinical experts who assess the research team's findings. Sometimes they'll pause the trials to check the results, always making sure the candidate vaccine is safe. The next phase involves testing a larger group of people to find out the appropriate dose, whether it stimulates an immune response, and of course, to assess its safety. Once the results
Hello, everybody, and welcome to our final session. It's my great pleasure to be able to welcome you to our Youth Success Stories session. Now, it's no secret that this pandemic has brought about some incredibly challenging times. It's exposed significant cracks in our healthcare system and brought significant hardship around the world. However, with these hardships also comes opportunity to innovate and opportunity to build back stronger. There's a famous quote by Plato, which states that necessity is the mother of invention. Now, these speakers in the session today have become experts in identifying where there is a need and finding a way to meet that need. It is my great pleasure today to be introducing Dr. Adhiambo David, who is a pharmacist as well as the co-founder of Rye Culture Health and Social Innovation. This is a forward-looking social enterprise committed to improving quality healthcare services and promoting human capital development. Thank you, Dr. David. Please go ahead.
Thank you so much for the introduction, Sunil, and thank you everyone for being part of this session. I believe you all can hear me at this particular moment.
Yes, we can hear you. Please begin sharing your screen.
Thank you so much. I've just done that. Confirm you can see it. I'm going on slideshow now.
Yes, we can see that. Thank you.
Perfect. Thank you so much. So it's a pleasure as well to be part of the discussion and for the great work that the Global Health Workforce Youth Network is doing in terms of promoting young people, engagement of young people in driving different stories and ensuring that we improve access to healthcare and drive that agenda moving forward together. So for this session, as has been introduced, we're talking about the youth success stories and talking about the work that we've been doing. And in this case, I'm going to talk specifically about the work that we have been doing as Agriculture, Health and Social Innovation. I'm a co-founder of the organization as it is. So as mentioned, our focus is on looking at how do we improve access to quality healthcare services as we promote human capacity development. And the areas that we focus on is in health systems strengthening, capacity building, and innovation. That is specifically social innovation, where we look at how do we ensure that the access to care that we do is anchored to address some of the underlying social determinants of health and the contribution towards ensuring people are healthy rather than looking at how they access care at the end of the chain when they fall sick. So our programs are specifically we have the health pillar where we look at health advocacy. we have youth empowerment program, the social innovation component, and finally community empowerment. And when we talk about all these, I'll highlight some of them in the discussion in terms of the work that we've been doing over this period. And the most critical bit that I wanted to highlight at this point is, as we work with young people, our angle has been on what are young people doing in their local community? Because what we believe is young people are living in their communities. They're seen as people who have an impact and they're people who can contribute, and they identify challenges because they're coming from a point of seeing the challenges that are there that need to be addressed. And now the next phase would be, how are they addressing them? And how can we enable them do that? Because that is where the innovation and the creativity, ingenuity of young people is coming into play. So the only thing and the best thing that we can do is give them a platform where these innovative ideas, these success stories are going to be realized, and these successes are being realized in terms of improving access to care and ensuring each and every individual where they live is not only able to survive, but is able to thrive and succeed in whatever endeavor that they are keen on pursuing. And that is what we commit to doing as Agriculture, Health and Social Innovation as an organization. So on the backdrop of COVID-19, I can highlight that on 13th of March, 2020, the first case was recorded in Kenya, where I come from. And as an organization, our focus with the organization was established in 2017. And since 2017, our focus has been within the universities and the different environments where we engage with universities and our local communities where they work or where they come from and they operate in. So based on that, most of our people are young people, especially university students, and with the focus of most of them being either pharmacy students or medical students, or if not, they are people who are in the social development sector, but they have an inclination towards the health component of care. So on the backdrop of COVID-19, we pivoted in the sense that most of our activities which were physically engaging and we needed to interact with communities most of the times had to stall because we are looking at the containment measures. So in that case, we now moved into the Operational Research Task Force, and this became the critical flagship program where we are looking at it in terms of not only reaching out to communities and continuing the health advocacy and health communication work that we're doing, but looking within. We had a team that was impacted. How do we enable them to be able to thrive during this point in time? How do we enable them to continue with their education? Because one of the things, the disruption that we noted was education of the students that we were working with, especially being the team was majorly composed of students, was going to be stalled because the universities were closed down, different training institutions were closed. So their continuous learning was already stalled, and there was need to ensure that we find ways to enable them continue learning. Social support networks, I used to interact with my friends, some of them were part of the team, but at this particular moment, it wasn't there as much because there were containments and we had to ensure that we adhere to the protocols and avoid putting each and every other person within the team at risk of getting infected with COVID-19. There was a gap in terms of refined and contextualized medical information on COVID-19. We all acknowledge with this forum that COVID is new, and even now, as far as we've gone a year plus and some months into the pandemic, there are still unknowns about the pandemic as it is. That is COVID-19, the treatments that we had, starting from the point of hydroxychloroquine being flaunted as the most effective one, to the current phase where we know and we acknowledge that the vaccines are better, more equipped to solving us and helping us get out of this pandemic that we are. But this information wasn't as contextualized at that particular moment, and everybody was looking for information. And on the same background of that, we acknowledge that there was so much fake news that was coming. And with that fake news, it either some were disbelievers, some were sharing false information that was affecting the response that we needed a concerted effort. So what did we do as an organization? One, to ensure that we continue learning, and not only learning such that people are pursuing the coursework, that is the work that is done by the universities. In our case, what we said is COVID-19 is here. It is within the domain of work, which is within the healthcare space. How do we ensure each and every member of our team is equipped with the right information so that in whichever space you're operating, you have your family, you have your friends, you have your colleagues, wherever you're working or you interact with them, get the right information. And in this case, we went to the different information sources, reviewed this information, wrote articles and published them on the agriculture website so that whoever went to our website could access that information. And even now it's still there for whoever wants to access it on agriculture.org. So that was the first phase, and ensuring that most of our team members had the right information. After that, we moved to the aspect of ensuring that the information that was being shared with others, and we continuing that work, and we even integrated with other professional associations like the Pharmaceutical Society of Kenya, the AMRA Association representing pharmacists in Kenya, and some other youth-related networks, Health NGOs Network, Kenya Healthcare Federation, and related. We are part of these forums and response teams where we could share some of the work we are doing, the best practices, and how we can do better as a team. Beyond that, we now, over that period, because we couldn't meet in person and have our discussions and all, we now went to having weekly sessions where we could just have chats as a team. And this became a routine that each and every one of us knew that every Friday at night, once we are done with everything for the week, we could have a debrief session, we review the articles that we wrote, and just have a chat. And that was the critical contribution that we had over this period. And I can acknowledge that after a period of the last year, that was 6-7 months from April, in November, December, we published reflections from the Agriculture Cooperational Research Force. And if you can see on my right, that is the cover of the page. And those are the members of the team, starting with Lillian, Veronica, and as the team as it is, you'll see some of them here. And these are reflections from them. One from Dr. Veronica Njambi, a pharmacist by profession. The group has helped me reimagine and find life as what we make it to be, by who we are rather than what it makes us to be. Then we have Hezron Minyakin, luckily enough, is also part of the coordinating team. The ability to learn is a skill, but the willingness to learn is a choice. We have to be versatile to move on with life so as not to miss on opportunities that could come by us as we wait for the problem to subside. So we have to take advantage of the opportunities. And that was a quote from them. And these are also reflected in the publication that we developed after this session. You'll have access to the link in the materials that we have. Then the next phase, what we did was we had the Youth Voices Network. And this was culminating from the fact that there are so many young people, and even in our country, we realized even the ministers, the different politicians and leaders and in our country were calling on young people because the risk of infection and the risk of developing severe complications were less among the young people. And therefore, these were a resource that could be put to use. But who was putting them to use? And if they were being put to use, to what use were they being put to? And how effective and impactful were they in this job? So what we realized is these people need coaching and training and guidance, which was critical. And beyond that, they need guidance on how they're going to do that work. So we had the Youth Voices Network that had been a training program generally for professional development. But at this point, what we looked at is there's a need, ensuring that these young people who are working in their local communities can continue doing the amazing work they do with more impact. And we amplify this work by mainstreaming it into policy forums and policy discussions. So that is what we looked at in terms of ensuring now we're equipping these people with skills, competencies to ensure they execute with impact. And then on the other case, we are looking at now sensitization, distribution of essential supplies, all the work they were doing. And we identify thematic focus areas. And that culminated in the Youth Voices Network Summit that we hosted last year. That was on 3rd and 4th of December 2020, not 2021. So during the forum on 3rd and 4th December 2020, we had people talking about social innovation in their different spaces. For example, we had a team working on fighting fakes. With COVID-19, we know there was actually overflow of substandard and fake products in the local markets that had to be addressed. So what were they doing? They share some of these practices which are being adopted in the policy forums and even in the advocacy networks to ensure we safeguard the health of the individuals within our communities. We had a presentation on access to sexual reproductive health and reproductive services. Young ladies who have challenges in accessing menstrual products and menstrual hygiene materials were affected because in the country, as part of the education policy, these supplies were given through the education programs and through schools. With COVID-19, schools were closed. So how are we going to ensure that young ladies continue having access? There were people working in that space, ensuring their communities were mobilizing resources, the young ladies are getting access to these materials, and they were being empowered to take lead rather than waiting for support from the government, which was not forthcoming, considering the challenges of the pandemic. So those were some of the best practices as well. We have another person in the dance club, the Latin 254. NCDs are a challenge, and we all acknowledge that NCDs are on the rise, diabetes, hypertension, and related. So how are we going to ensure people are active at the point when even the physical activities were reduced? They had the Afrozala Latin 254 dance groups and where they dance salsa dances. So what were they doing? Ensuring that they could have virtual dance sessions, the virtual trainings and all that. And as they were doing them, they were enabling their members to stay connected and engaged. And these are some of the best practices. So through the Youth Voices Network, the focus was, let's give them the skills and empower them. And other than empowering them, let's now give them a platform to share the best practices. With the best practices, we engage with a couple of partners. As you can see on my left, the Youth Voices Summit report, it's on our website. You can look at it, get it from there as well, and I'll share the link. We have UC 1000, one of the companies that are dealing in nutritional supplements, especially vitamin C. Philips Therapeutics, one of the pharmaceutical distributors. Youth in Action, part of AMREF, Quality Healthcare Awards. Then we have Health NGOs Network, HENET, if you can see at the top next to Reculture. That is the umbrella organization for civil society organizations and NGOs in the country that are looking at how do we mainstream best practices from the non-for-profit organizations that are ensuring people have access to care and ensuring we improve on policy making from the aspect of top-down approach, but looking at the middle level. The bottom-up works, yes, in certain areas, but it depends on the ability of the people to know what they need and how it needs to be implemented. In our case, we were talking about the people who are actually doing the work with the technical know-how and making them share their voices so that we have contextualized, technically sound, and proven programs that were being adopted. So that was the scope of the Youth Voices Network at this particular point. So on this slide, I just give the additional resources where you can have access to the Operational Research Task Force reflections, the Youth Voices Summit report, Spotlight on COVID-19 Next Steps. Those were compilations of young people sharing their stories and how they see the different sectors where they work in going to change. There's an article on mental health. They have an article on architecture, the future of architectural work and the contribution in the pandemic, the future of IT solutions and digital solutions in our operations day-to-day life. That's on Spotlight on COVID-19. Then the CSO Chats webinar as well. That was a series that we co-curated with MyDAO, one of actually the first e-pharmacy in Kenya. And the focus was they have the people accessing products from the digital platform. So how do we engage and ensure people know about the risks, but at the same time, they know the option of how do they can get their medicines. And the focus was on NCDs, specifically hypertension and diabetes, because they had a higher risk of succumbing or developing complications from COVID-19. So MyDAO has the solution where they can access their medication through an online platform. On our case, being our focus had been on health communication and advocacy, we were helping communicate that message, but at the same time, highlighting the risks and what they need to do to ensure we promote healthy living and safe outcomes from the point of where we're dealing with a pandemic, we have to stay healthy, we need to continue accessing our medications. Then that is an article on why Youth Empower should be deliberate, intentional, and structured, reflecting on the work that we did, what we are looking into the future, because at the current moment, we are fully launching the Youth Voices Network as a training program for young people in the country, and even beyond as we see how we can amplify the voices of young people and improve access to healthcare, and we ensure that we build the capacity of young people, because these are the people changing the different societies where we live in. Unless they're helped, and not only being helped, but they're being given a platform where they can manifest the value and the critical contribution they have to the society, then that will be the way. So we believe we are going to do it right, and we're going to do it with partners and organizations that are part of the movement. And I'm glad that Global Health Workforce Network Youth Hub had the platform to help us share this story and also contribute in inspiring someone to take action where they are, sharing a best practice with someone who can adopt it in their spaces. So let's do it together and let's work as a team. Thank you so much, and back to you, Danielle.
Thank you, Ariambo. I really appreciate you sharing your story with us, and you and your team are doing some really fantastic work getting youth voices out there and raising the level of healthcare being provided. I'm very happy to be able to now introduce our next speaker, who is Dr. Enno Stevens. He is a youth frontline health worker, a sexual and reproductive clinician, a skilled youth engagement consultant, and the founder of Self Consult, which is a web-based application in which he provides antenatal care. Dr. Enno Stevens, could you please begin and upload your presentation?
Thank you very much, Danielle, and hello to everyone. Can you now see my screen?
Yes, we can. Thank you.
Okay, fine. So thank you very much. As Daniel said, I'm called Enno Awa Georges. I am a youth consultant with the Lancet Financial Times Commission, and I'm also a sexual and reproductive health clinician. I am based in Cameroon, and I provide sexual and reproductive services to women and girls in rural humanitarian setting in the northwest of Cameroon. And today I'll be talking about my story with Self-Consult and how I came about innovating Self-Consult within this very tough period of COVID-19 pandemic. So my presentation will follow this order. I'll begin with the problem, what we're currently facing, which is the COVID-19 pandemic. And the solution I brought, Self-Consult, which is actually a virtual clinic. And I'll also be looking at how I use digital technology to provide healthcare. And lastly, I'll be inspiring you on how you can use digital health technology in such difficult moments in which the world is facing. So we all know what we're currently facing in the world, which is the COVID-19 pandemic. And the COVID-19 pandemic is a very devastating disease, pathology, virus, which has killed a lot of people in the world. And it has brought a lot of problems. I must say that following what the Director General of WHO said, it has put the world on its knees. And we have to come together and join forces to see how we can combat this virus. So basically, what has COVID-19 done? Many people are now scared to come to the hospital because of the virus. Take, for example, in Cameroon and Sub-Saharan Africa, many people don't come to the hospital. They claim that if they come to the hospital, they will contract the virus. So according to them, the virus is in the hospital, including women and girls who are very vulnerable. There's also been an increase in sexual gender-based violence due to the lockdowns. And you know that because there is lockdown, many women and girls now stay with their perpetrators. And so they find themselves in acts of violence. And this all is because of the COVID-19 pandemic. Again, pregnant women prefer to deliver in smaller clinics or at home for fear of going to the hospital or bigger hospitals for not to be infected with the virus. The lockdown have limited access to healthcare for women and girls, especially in rural communities. You can imagine how healthcare is very important, yet due to the lockdowns, many people cannot access healthcare. And these are all the problems I realized while working in the field. And to me, the question was, how do I solve this problem? How do I bridge this gap, especially during this very difficult moment? How do we solve these other problems? Because all these were existing. Now COVID-19 came. It is true the virus is there, but how do we solve the other problems, the other secondary problems that the virus puts on people? And this is the reason why I came up with Self-Consult. It's actually a virtual clinic. And this Self-Consult was funded by the Tony Elumelu Foundation program, which is called TEF. I'm very honored to be a recipient of this grant to come up with this innovation. And Self-Consult uses the power of low-cost technology and leverages on the availability of mobile phones. Almost 50% of the population in Cameroon now have Android phones. And so because of that, it's easy for us to use a web-based application and an online service where I can provide antenatal consultations to patients at the comfort of their homes. If pregnant women say, okay, fine, we don't want to come to the hospital again because we have the COVID-19 pandemic, we are afraid of getting the virus. Okay, can we have antenatal consultations via phone, via telemedicine, via online? Of course, Self-Consult made that possible. I also choose Self-Consult program visits for women, and those who wanted to consult. That way they can limit their stay in the hospital. Usually what happens in Cameroon is that people have to come and stand in a long queue of line, to see a doctor. But once their visit, their consultation is programmed, at that time they will come at their slot, at their time when they have to consult. That way it will limit their stay in the hospital and there will be no long queue standing in front of the doctor's office to be consulted. Also, normally by WHO recommendations, women who have delivered need to stay in the hospital maximum 72 hours. After 72 hours, post-delivery women are supposed to be discharged. Now, with Self-Consult now, I was able to follow up these women at home via telemedicine. I followed them up at home and limit their stay in the hospital so that they will curb the spread of the virus. Also, Self-Consult helps to respond to the needs of adolescent girls and young women via telemedicine. You can imagine the problems that young girls and women face, especially accessing sexual and reproductive health. Let me remind you that before the COVID-19 pandemic, young girls had difficulties. Why? Because of the stigma they go through. They cannot access contraception free of charge. It's seen as a taboo for a young girl of 18 years to go and buy a condom. So many young girls always face stigma accessing sexual and reproductive health services. Now, COVID-19 came again. With telemedicine, it's very easy. They can access the services at the comfort of their homes. I just talk with them online. I prescribe the whatever they have to take, and they go and get it in the nearby pharmacy. This is what self-consult offers. Now, this is how the platform looks like. It's a normal application where an individual goes, registers, and puts on all your information, who you are, your past medical history, your relevant surgical history, whatever information you deem necessary for the doctors to read, you put it online. You can choose the doctor you want to consult, what kind of specialist you want. Is it a surgeon? Is it a gynecologist? Is it a gastroenterologist? Whatever specialist you want, you choose on the platform. Also, you can choose pharmacies that are online, pharmacies on call, because also getting pharmacists is the problem. So with this app, you can get to know which pharmacy is on call and where you can get medications. Also, through this app, you can have peer support. You can chat with other people and have peer support. Talk about your situation, share your ideas, especially when it comes to sexual and reproductive health. You can share your ideas, and through this platform, many people have given testimonies of how it has helped them access healthcare. And so these are some of the things that inspired me most, because sitting in the hospital every day and waiting for patients to come, I must say it's not very easy, because many people can't access healthcare due to poverty. We are living in a resource-limited setting where to access just 3 square meals a day is a problem, talk less of accessing healthcare. You see that through this innovation, it is easy now for women and girls to access SRHR services at the comfort of their homes. Now, how have I used digital technology to improve healthcare? As I said, digital technology is a very important tool we must use, especially at this moment. It's very critical, especially for young people. We are the ones using the innovation. We are the ones on Facebook. We are the ones on WhatsApp. We are the ones on TikTok. We are the ones on Instagram. We are the ones on Twitter. How can we maximize that tool, that technology, to leverage and to curb the spread of COVID-19? Now, I created a WhatsApp group, a digital community, where I had my friends, a network of young people who could fight misinformation about the virus. Again, in Cameroon, many people think that COVID-19 pandemic is a disease of the rich, that poor people don't get the virus, which is a lie. And young people can use social media to educate the population, to create awareness, and to say this disease is not only for the rich, even the poor can contract the virus. We organized a Twitter campaign to combat misinformation, and we had the hashtag COVID-19SS. And I also said this on online antenatal consultation for patients. This is what I do on a daily basis. Also, I offer support to women and girls who have experienced gender-based violence. And also, we created a safe space for adolescents and young people to access SRHR services, because this is very crucial, very important for them, especially during this period where there is lockdown. Now, how can we use digital technology? As young people, what can we do? How can digital technology help us? I must say that digital technology can help us to curb the spread of the virus. Because through digital technology, we can talk to our friends on Twitter, on Facebook, on TikTok, and say, wash your hands regularly. Always put on a face mask when you're in a public place, in public gatherings like market, the shops, Through digital technology, we can provide healthcare services now. I can't overemphasize on the power of telemedicine. Telemedicine, we are now talking online. I'm doing this presentation to you. What if I was talking to a patient who needed a service? You can imagine the power of digital technology. Of course, it can stop the spread of misinformation. Misinformation has killed many people. The lack of right information has instead destroyed many people. And so if you see that if we can use digital technology correctly, we will stop misinformation. We will stop the spread of wrong information about the virus. Like now with the vaccine, there was a lot of myth about the vaccine. Many people are scared of taking the vaccine. In Cameroon, where I am, some women have said, oh, we heard that when you get the vaccine, you become infertile. Some of these misinformations are supposed to be stopped. By who? By young people. We have the power. We know how to use the technology. We have become more digitally literate. And so we can use this technology to stop the spread of misinformation. And also, we can have collaborative innovations and solutions across all levels. You must know that digital technology is we can use it in a multi-sectoral approach. It is not only in healthcare, it's in agriculture, even in ICT. There are many other domains where we can apply digital technology. And through it, we have also had patient satisfaction and staff satisfaction. Now we have electronic medical records, where we can record all data of patients, input all the data of patients, and collaborate with patients. This relationship between the patient and the providing staff has become much more easier through digital technology. All these are ways in which young people can maximize the use of digital technology. It's not only about chatting online. It's not only for getting information, but also we can use it for our health. We can use it to get the right information, to stop the spread of misinformation, especially. So through this innovation of self-consult, I was able to bring healthcare at the doorstep of women and girls, especially because that's what I'm passionate about. That's what moves me most in my job. And I said, no, I wouldn't sit only in the office to wait for patients. I'll come up with something that can help women and girls in this period of COVID-19, provide them with the right healthcare, the right knowledge, the right information they need to spread to stop the spread of COVID-19. And I believe that as young people, as future physicians, as future healthcare personnel, we can do the same. We can come up with innovations. We can think out of the box and see how we can help, especially stop the spread of COVID-19 during this moment. I thank you very much for your kind attention. And I'll hand it over to Danielle.
Thank you so much, Eno. I really appreciate you sharing with us how you've been able to bring healthcare to so many women and girls. Your work is truly critical, and I appreciate you sharing your story today. Our next speaker is Dr. Frances Nyon. She is a graduate of industrial pharmacy from the University of the Philippines, where she is currently pursuing a PhD in economics. Frances has spearheaded the telepharmacy service for the College of Pharmacy at UP, which has served more than 500 patients since its inception. Frances, please start your presentation. We really look forward to hearing from you.
May I ask if you can see my slides?
Yes, I can.
Okay, so let me start. Good morning, afternoon, good evening, everyone. I will be sharing with you a university volunteer service we have started during the upsurge of the COVID-19 pandemic in the Philippine setting. So this is a service supervised by the University of the Philippines, Manila, College of Pharmacy with its professors, alumni, and students. Okay. So just a brief background of the primordial effects of the COVID-19 pandemic in the Philippines. A national lockdown was implemented starting March 15, with a gradual easing after a few months and stricter implementation during times of resurgence in localized communities. During the strict implementation of lockdowns, locally, we call it enhanced community quarantine or modified enhanced community quarantine. Only one person per household is allowed to go out using identification cards provided by local governments, which is strictly checked by public enforcement. Businesses are also closed except for essential services such as healthcare services, groceries, and banks. Almost all offices have transitioned to work from home setup to reduce transmission. Also, public transportation was closed, thus access to services was hampered, especially since most Filipinos do not have private vehicles for transportation. So coordination for transfers to healthcare facilities is given through the assistance of local governments. So because of this, non-COVID-19 patients have limited access to various community health services, including access to pharmacies for their maintenance medications and adequate provision of drug information services. due to the current setup of the repeated strict lockdown implementations in the country because of sudden spike of cases. Community pharmacies have shifted to online deliveries of medications, limiting the provision of appropriate medication information to patients, but has been a great way to provide access to medicines. Misinformation has also proliferated during the pandemic, and use of different and various treatment modalities, from off-label use of medicines and use of complementary alternative medicines, including the overuse and misuse of vitamins and supplements, have been rampant in the country. So because of this, these practices, the University of the Philippines College of Pharmacy, with the aid of the Philippine Pharmacists Association, proposed a telepharmacy drug information service. So just to give you an overview, we provide drug information service through an online platform. So currently, it is being accessed through social media such as Facebook. In this way, we can reach the maximum number of patients, especially that in the Philippines, data on social media use show that 96% of Filipinos accessing the internet rely on specifically on Facebook as their primary source of news and platform for even for product placements. The service is implemented and ran by the UP Manila College of Pharmacy under our telehealth committee. So in the UP Manila, various telehealth platforms have been created in different colleges. So it also includes our university hospital, the Philippine General Hospital, which is also the largest government tertiary hospital in the country. So I am also a member of the university's telehealth committee, and we have been devising ways to optimize telehealth pathways across these colleges and hospital implementation, including integration of these platforms to our curriculums. So the objectives of our service is to actively provide and deliver evidence-based drug information to patients through an online platform. We make sure that the data or information we provide to patients are backed up by latest evidences through the use of primary and secondary literature, and to apply medication counseling skills for students through remote patient consultations. Because we're currently in an online teaching setup as well, the telepharmacy service has been a platform for our students to use their skills and proper provision of information to our patients and apply medication counseling skills to the patients they interact with. So all our human resources in implementing the service are either registered pharmacists who are professors or alumni of the college, and also pharmacy students from our college as well. A patient submits a query through a form that is found in our Facebook page. So this query is then transmitted to a database being accessed by volunteers. So the consultants review and provide an answer to the query of the patient, which is then checked for appropriateness by the validator. So after validation of the answers to the query, the sender provides the answer to the patient either through Facebook, email, or SMS message. So the whole duration of the process from the receipt of the patient query to the sending of an answer takes around 1 to 2 hours, depending on its nature. So sometimes we also receive questions relating to renal dosage adjustments and medication reconciliation and scheduling. So it takes more time to process. So this is an indirect process of communication with patients, which provides us with adequate time for proper review of significant resources. However, as the service is already growing, we have already met up with current implementers of the telehealth service of our university hospital, so that the telepharmacy service can be integrated in the telephone-based patient consultation setup in the future as well. So let me just share with you some data. So most of our queries submitted are from patients between 20 to 40 years old. This reflects the current setup of the service, which is available through social media and is more widely used in this age group. Patient queries are also being categorized to different inquiry types, which is designated by the consultant. Most of the questions given by patients are about over-the-counter recommendations to various ailments, multiple categories, which are usually questions regarding the use of their maintenance medications, used concomitantly with vitamins and herbal medicines, and proper administration and dosage of medications. So actually, as of yesterday, we have already answered 675 queries through the service already. So just to share with you, some lessons learned. So lessons that I learned in the process of actually getting this service approved and implemented. So it is important that we are working in an enabling environment where suggestions and recommendations for improvement are accepted by the institutions that we work and we thrive in. Another important point is mentorship. I am very blessed that older faculty and officers from our pharmacy organization has been very open to work with me and to listen in my suggestions, and also from other youth sectors. They were very important drivers for the implementation of the service because they have been my active guide in providing improvements to my proposal and have also helped me talk with key personalities for its success. We also need to be resourceful. So in a low resource setting such as the Philippines, especially that we are a public national university, we don't have the luxury to actually spend too much for newly founded services. So we make sure that these resources are used in the most efficient and timely manner. That's why I'm also very thankful that there have been a lot of volunteers who have really been a great help for the success of this service. Lastly, perseverance. If you know that an endeavor is beneficial to society or even a small community that can provide positive change to, then we don't stop with the idea. We implement this idea and repeatedly check up on its processes to deliver it more efficiently to the patients that benefit from it the most. So with this, I end my presentation. Thank you very much for this wonderful invitation to share my experiences.
Thank you very much, Frances. I really appreciate you taking the time to share with us today. And you've really chatted about a wonderful program that hopefully others around the world will be able to implement as well. We are moving on to our final speaker. I would just like to remind everybody that after our final speaker, we will have a brief question and answer period. So should you have any questions for any of our speakers or all of our speakers, please put them in the chat box and they will be touched upon. And for our final speaker, we have Ian So, who I'm very happy to present. He is a Malaysian medical student studying at St. George's University of London. Ian has founded the movement More Viral Than the Virus. It is an independent global COVID youth movement, which has reached youth from over 100 different countries. Ian, welcome.
Thank you, Danielle, for the wonderful introduction. And to my esteemed colleagues, good morning, good evening, and good afternoon to all of you. Just to elaborate a bit more about what More Viral Than the Virus is, to give you an introduction, but for this presentation, I want you to not just listen to me, but I think what I want you to do is to think with me so that you can do something like this yourself too, because I think this is the purpose of this presentation. So a bit of context about More Viral Than the Virus. At the beginning of the pandemic, we, in response to Dr. Tedros' message to young people about how, well, you as young people, you need to know that you are not invincible to coronavirus, and that, remember, your actions actually have consequences, especially to the older members of your family. And I'm a medical student. I was only a first year medical student, and I can't treat anyone on the front lines just yet. So like other medical students who also want to help, and we're confronted with the unavoidable fact that we're just medical students. So recognizing the problem from the WHO as a problem, we were determined to find a solution. And that solution was that we as young people, we as medical students, we can actually be that alternative voice. And that we as young people as well, we have this social responsibility to educate our peers, other young people, of the key messages of the WHO, and address this worrying attitudes of young people that Dr. Tedros himself was speaking about, and to correct all this misinformation and disinformation which all the other speakers were talking about earlier, and also to tackle this issue of mental health, and also to, for instance, now also tackle vaccine equity, and also highlight other pertinent COVID-19 issues. So this is on a broad aspect of what we have been doing since the beginning of the pandemic. But what I want you to think with me was that, well, why is misinformation thriving in our communities? And we were trying to find this solution, because it was a problem. Everyone did not know what COVID-19 was. There was panic, there was mania, and what we did was we sent a message of belief and sent a message of hope by uniting other medical students from over 30 different countries at the beginning of the pandemic, just to say, well, we're in this together, and that we believe that we'll get through this together. And with that initial attempt, it was successful. And we decided to tap onto one of our strengths, which was translating information into local languages. And if we were to go to the next slide, please. Thank you. Basically, we realized that there's actually a lot that can be done in your own local communities as a young person. When WHO produced, when the CDC produced guidances for communities, it was mostly in English. Some people would say that it's not particularly relevant because what happens in, say, a community in Brazil, it would be different as to if it were to be a community in the UK, in London, for instance. And this was where we realized that actually we can effectively translate these guidances. And all it takes was just some form of knowledge of the matter and translating it to make it relevant to local context. And that was exactly what we did. But but again, you'd probably be wondering, and you would possibly be in our position as well, to think, would it even work? Would people even want to listen to us if we even share something like this? And I have the example to show it to you here. So our Mexico local movement, basically we see the picture on the left-hand side of the screen there. You can see that there are actually 450,000 shares on Facebook without boosting. So our local movement started with the idea of trying to come together to try and solve something. And with no prior knowledge of using social media like Facebook, not knowing how to run a Facebook page, it's actually possible. And I want to show it to you that it's actually possible if you want to step up and do something like this too. Because we did not use any funding, we did not use any other expertise. It was just this whole pure will to try and help. And to just elaborate a bit more about how we did this, all we did was WHO has produced great guidance in English. So if you see on the bottom left-hand side of the picture, you can see the COVID-19 Mythbusters that WHO was doing, which was really good. There were very good graphics, there were very good information. But then again, a lot of us would say, well, there's a lot of words there, there's a lot of information to process. So what we did was we break it down and we link we link our posts back to WHO, to funnel people back to WHO so that people can take them in bite-sized forms and in their own local languages. And then the next thing you'll be probably wondering be, well, at the beginning of the pandemic, well, it's a lot of people started started a lot of initiatives to try and solve this, try and solve and overcome this pandemic, try and overcome the effects of this pandemic in their own local communities. And I think you would also be wondering about, I feel like I'm actually competing with another initiative, and actually how do I stand out? Because, well, now that I know that there's actually a lot of information about COVID-19, then possibly I could put it in an infographic so that people will possibly want to see my post, right? Because that's something that you instinctively want to do. Now, my question to you is, well, we believe that besides being the alternative voice, we also need to do that in a creative way. And that is exactly like what Dr. Stevens was mentioning earlier about how we can use TikTok and use different forms. And what we realized was that we could actually use digital filters. So the BBC on the right hand side of my slide now, you can see on Instagram, you could actually play around with filters, and we can actually just get people, well, you want people to wear a mask? Well, let's do it in a fun way, to encourage mask wearing. And also, if you can see on the bottom part of the pictures, you can actually see that we get them to do different things. It's kind of like a pledge in a way, but and what we also did, instead of just getting them to recognize the pledge, we also translated the pledge into 21 other different languages, so that they can understand it in their own languages. So highlighting again the relevance, making sure that whatever you produce is relevant to the communities that you're targeting. And to my next slide, please. Yeah, all right. So on this slide then, I have this little secret I want to share with all of you, because this movement, I want you, if anyone in the audience today, anyone listening to this, you're probably wondering, how can we reach 100 young people from 100 different countries by will? How do we do this without any funding? Then my answer is that we used Instagram, we used Facebook, and we used WhatsApp. These are only 3 forms. We did not use LinkedIn at all. But on top of using this social media platforms, what we also required was that we needed to stand out. And again, reiterating the point about creativity, you could reach out to your audience using comic strips. Comic strips has been an effective way of communications for centuries now, and breaking it down to interesting formats would actually help capture attention. And some forms that you may not have considered, but you probably have seen used when you message on WhatsApp groups, for instance, GIFs. GIFs are really good. It's another way to do it. And of course, storytelling with scenarios is another way to basically make relevance of something that you're trying to share in a particular community, so as to make relevance to the audience that you're actually trying to target at. But now, then the question is this. Some of you are possibly listening then, how did we actually reach this? How do we get to this point of being able to effectively share with our communities? How do we actually run our initiatives at More Coronavirus? Well, the secret for that is actually our 6 R's. So to make any of all these work, for any initiative that you want to work at or be involved in, I want you to think of the 6 R's. And they are, the first R is to recognize, second R is to research, third R is to relate, the fourth R is to make relevance, fifth R is resolution, and the sixth R is reflection. But let me elaborate this really quickly. So going through the idea of misinformation now is a problem. Like all our other speakers, we recognize that misinformation is a problem. So we recognize that as a problem. Now we need to research why it is a problem. We need to identify the challenges. We need to identify our audiences. Who are we actually targeting? And actually know what you're saying, because you do not want to be adding to that misinformation. Now you also need to relate. So that's my third R. You need to relate. You need to understand why is this happening after researching, of course. And of course, you need to make relevance to it in order to gain support. You need to speak in the language of the community, and not just speaking in the language. What I mean is actually colloquially speak in a way that people will understand instead of using jargon. And as medical students, we have this edge in the sense that we understand what's happening, and so we were able to get past that little challenge there. But then now onto my last 2 R's then, resolution and reflection. Now, why resolution? That's quite a big word there. what I'm trying to remind you is that you need to commit to your purpose. You need to remember why you started this in the first place. Like a lot of my other colleagues who have started initiatives about COVID-19, and a lot of them also went global. The problem is about this idea of stamina, this persistence, this ability to go for the long mile. You need to remember why you started this. So you need to be resolute in what you're working on. You remember why you started and continue that. That's most important. And of course, at the end of all of this, it is to reflect on why you did what you did, and so that you can improve your initiative later on. And on to my last few slides now. I'm almost done. So I just wanted to remind us all, in a sense, that as Dr. Stephen and David and Francis, my other colleagues who were sharing earlier, we have this great capacity because we are on social media. But I want you to be very careful as well. This fine idea of misinformation has a fine thread, in a sense that you need to be able to recognize that misinformation does not necessarily constitute to words, but it could be behaviors. So we need to find our voice, we need to find our capacity to identify misinformation. And it could be very simply about being on TikTok and dancing to, well, I've taken the COVID-19 vaccine and this is how you react to the COVID-19 vaccine. Well, that, in a sense, could be a fun thing to do, but that may not necessarily be true, and that could actually instill fear. So I want to remind you, because this actually happened at the very beginning of the vaccine rollout, and the effect of that is actually detrimental. If, as you can see, when it reaches an audience of 2.9 million people, that's actually quite dangerous. And on to my next slide, please. Thank you. And this is my last slide. Well, all I wanted to say is that, well, to each of you listening to this presentation today, you are based in a community, and you're probably wondering, how can I help during this COVID-19 pandemic? Remind you that it is this idea of coming together as a collective, remembering that we need to stand together in solidarity, and we need to make sure that we collaborate, not to compete with one another's initiatives, but to actually embrace this idea of collaboration. And of course, we have done so in different countries for other local movements, and particularly India now. With any of our audience who is from India, I really want to reach out to you to really step up and maybe even join us to help and solve some of the effects of COVID-19 there, so that we can actually try and get past and see past this episode of the pandemic. But yeah, that's all I have for you, and I hope to share more about this later in the Q&A. And over to you, Daniel.
Wonderful. Thank you very much, Ian. It's really encouraging to see how much can be done, as you said, without funding, and with your brains and your own two hands and the powers of the internet that we have today. So thank you very much for sharing that, and thank you for your team for all their hard work as well. So we're just going to be moving on to a Q&A series. So as I did state, please send through any questions that you have to the chat. The first question that we're going to start off with, which all of the panelists can answer, is what was your biggest barrier to achieving your goals? And why don't we start in reverse order, and we'll start with Ian.
Thank you, Daniel, for that question. Actually, that's a very interesting one. So I'm not too sure if you remember me sharing this earlier, which is actually my very last point as well, is this idea of competing with one another about our initiatives. In fact, the initiative I was sharing earlier was about COVID. Dr. Stevens and my other colleagues, we're all sharing something similar about COVID-19, about what we have done. And in fact, we're inspiring one another about what we have learned, and I've learned so much today. But the problem is that there are actually other people also doing what we're doing. But sometimes there's this conflicting idea that, well, this person's initiative is doing so much better, so I should stop what I'm doing. And that is actually a challenge, because when you see other people who have done so before the pandemic, so more of us established this during the pandemic, we actually sort of say, found it challenging at the very beginning because we didn't have any resources, we didn't have any funding. Was this even possible? In a sense that, well, there are other bigger initiatives that, for instance, in climate change by Greta Thunberg or other social activists. So this idea of collaboration and standing together in solidarity is actually really important. When you set aside your differences to actually come together and think about solution and not think, and of course, have this idea of trying to figure how to help, how to find a solution aside our differences. So it doesn't matter whether or not you are senior, whether or not you are young. I want to highlight and show that it's actually possible, because I'm only 20 this year. I started this when I was 19. And I just wanted to highlight it to all of you that it is possible. And I'm willing to show it, and I'm willing to guide you if you want me to, because I want other young people to do this. Because this can be in the form of climate change, it can be a form of LGBTQ. This can be done. We just need to come together and stand together in solidarity and collaboration. Over to you, sorry, Danny.
Thank you. That resounding idea of collaboration over competition, I think, is a big theme today. Would we like to go back to Frances? Would you be ready to answer this question?
Yeah, sure. I think one of the barriers to the service that we're providing is having volunteers to actually be available during their shift. So we rely on volunteers. So from our faculty, from our alumni. So we rely on their availability. If they're not available for the week, then there are times that we get too much questions, we get too much queries from patients, and we get overloaded. So usually, because I'm the administrator of the database, so usually I'm the one who sends the answers to the queries when there are times that there are no people who are available to be consultants. I'm the one who's answering the questions, but actually it's all right. Although if there are too much questions, it gets I have to answer them until at night. So I also get help from my friends when if there are too much questions that need to be answered. But we're already working on that. Since we already integrated the service as part of the curriculum of our students. Students are all specific subjects, specific courses in our college already allow students to answer the queries in specific times of the semester. So that really helped us answer the queries. Back to you, Daniel.
Wonderful. Thank you for that, Frances. And I'm sure everyone appreciates the amount of work that you're putting in. We'll go to Eno now to answer that question.
Yes, thank you very much. So I want to say that one of the challenges I faced was the fact of connectivity. Connectivity is a major problem, you know. Now in Cameroon and sub-Saharan Africa, connectivity has been a major problem. Accessing internet is a problem. The second thing is digital literacy. You know, many women still find it difficult to navigate apps online. So we have to teach them, you know, we have to educate them. We even talk to their children because, as I said, young people are versed with this transformation. And so we even advise their children, their senior children, to say, okay, teach your mom how to use this, teach your mom how to make a call, teach your mom how to go on WhatsApp. So these are some of the ways in which we overcome these challenges. And we also advocate that government, through the Ministry of Posts and Telecommunications, should improve on the broadband band so that internet connectivity can be much easier in a resource-limited setting like Cameroon. So these are some of the challenges I faced, and this is how I overcame them. Thank you.
Thank you for that, Eno. Certainly, we are often, I think, looking to younger and younger generations to sort out some technology. I know I've had to ask a few questions using Zoom in the past few months. Adhiambo, I would love to pose this question to you as well.
Okay, thank you so much, Daniel. So, and it's a wonderful question because we look at the challenges, and one of the critical things that I've acknowledged is, as young people, we like when we're looking at it, majorly it's looking at what are the challenges we're experiencing. And I acknowledge the challenges are there, but the question that for me we've been asking my team is, how do we go beyond this? And I acknowledge that some of the challenges that we've had as young people in our work and the kind of things that we're doing is the exposure. We want to do so much. We have so many amazing ideas, but we are not exposed and we don't have the courage and the confidence to take the first move. So for example, when we hosted the Youth Voices Summit, we're looking at it from the perspective of, we had over 17 applications and they call ran for only 15 to 20 days. So if 15 to 20 days, we already have 17 applications, then it means that these ideas, but the question is, do they have the exposure to ensure that they inform the policies? So that is one of the challenges that we had, exposure, young people getting exposed, and that informed the training program that we're looking at now, ensuring we expose as many people as possible. Then the other thing that happens is our team, as a team of 12 people, none of us is being paid. I started the initiative when I was in the university in 2017, so they're offering their time. But the question that I keep asking myself each and every single moment is, what value am I offering Hezron as part of my team? What value am I offering Veronica as part of my team? So at the end of the day, it's not a matter of using them for the value they're doing in the work, but what do they get out of it? You need research writing skills. So for me, it's a matter of, I have access to certain platforms and I have access to certain level of knowledge and competencies in my line of work. So how do I make it available to these people so that they are contributing to my work, but they're also deriving value that is enabling them to get exposed, to get the right knowledge and expertise, to be able to be better people in their line of work. And the last challenge that I feel is the segregationist mentality. I'm doing this and I want to keep it to myself because I think it's kind of a very novel idea. And that's why I like the presentation from Ian in terms of, let's everyone share ideas. Let's use them as much as we can, because we are looking at the impact, the impact of the work we are doing, the change we are driving in our societies. If I sit with my ideas reculture on this other end, how do I know that it's going to make some impact in Philippines? How am I going to ensure that people in Malaysia who need such services are going to benefit as I'm sitting with it? It will never get implemented if I don't. And life is just a journey between birth and death. If I die before sharing that idea, it will have ended at that point. So how do we make it get to the people who need it? So those are some of the things that I feel like we need to engage, and those are challenges and how we are working around ensuring that everybody sees the value of what we do and takes action from that point moving forward. I hope I've answered you. Thank you.
Thank you for sharing that thought. I definitely agree with you, and I appreciate the line of thought that you have of putting our patients before ourselves and making sure that we have open communication and that we can get everybody the benefits, not just a select group of people. The next question that we have that was asked by Manisha Jana is, since everybody is using social media as a tool these days, what are some ways to stand out and provide legitimate information? And as a follow-up question, how do we get stakeholders to invest in us when we are starting out? Is anybody ready to answer this question right away? It's a bit of a thinker, I think.
I can take this. Manisha, I'll answer the first question. I'll help you with the second one. So the first, and I think Dr. Stevens might also be able to help me with the second one as well, because I think we're in the same event as well. So the first one is that, well, as I was mentioning that even WHO as well, a lot of times our first form of medium to communicate to the public is with an infographic, right? A very nice picture with very nice text and then very nice cartoons and all that sort. But now there's so much information going on. And then of course, now you need to go in to look at why is TikTok so successful in all the short videos that they are producing. So from Mobile Virus perspective, when we ask ourselves, and then another point I didn't mention earlier was that by working with people not in the medical field, you actually get a lot of ideas. So we have like digital art students, and then they were just bouncing off ideas, and we were thinking, well, digital filters will work, GIFs will work, because this is a very simple form. And one way we have not tried actually, memes. Apparently, with our young people population, memes is another way to stand out, especially on social media, and also provide legitimate information. That information, you've got to be careful. You need to get it from CDC, you need to get it from WHO, and very much link it back. Make sure you link it back to the place where you got the information from, because you shouldn't be crediting anywhere else. And then I'm just going to touch on this point, and I'll possibly pass it to another speaker. About investing, I think that was done recently by the Big Six. I very much encourage you, if you want to get investment for local startups, local solution, do reach out to them, because I think they have 2 million USD, and I know that they're very interested to try and support if you need funding. So I know we do not have any funding, we have not used any funding, but that's something that we are considering as well at Mobile Virus. So if you're planning to start something in your own local community, do look at that. I think I very much recommend that that initiative that WHO has put together recently. But yes, over to you, Daniel.
Wonderful. Thank you for that, Ian. We'll go to Eno. I believe you were looking to speak next.
Yes. So I want to answer quickly to your question. Firstly, I will say that you have to believe in your idea. If you have an idea, if you have something, if you feel that you can be a surplus, you have to believe in what you're bringing in the innovation. How do you get legitimate information? I must say that when it comes to healthcare, whatever you say must have a scientific backing. And like Ian said, we have WHO, we have CDC, we have accredited sites where you can get the right information. How do you get investment funding for your projects? There are a lot of organizations that are willing to provide funds for innovations, for startups, especially during this COVID-19 period. We have like the One Young World. I'm sure you know about the One Young World. We have the International Youth Society, which is also offering grants for people or for young people who have innovative solutions. There are a lot of them. I can share some of these opportunities with you if time permits, but I must say that you need to believe in your idea and what you want to bring forth. And when you do that, investors will believe in you. They must see the impact you've made, first of all. And you can start small, but with time, you will get the investors. So believe in your idea, get the right information from the right source, because with science, be careful of misinformation. So you must know how to get the right information. And of course, go for the grants. You will get them once your idea is good, there is clarity, there's visibility, make it smart, and pitch your idea in front of investors. That's when they'll start looking for you. That's my advice.
Wonderful. And Ariambo, would you like to speak on this topic?
Just a minor addition to what they've all said. The other critical thing that for you to gain credibility and ensure that the work you're doing is making an impact and you gain that kind of, like it makes an impact, is a matter of how consistent are you with the work that you're doing. If I started Reculture in 2017 and let it die in 2018 and waiting for 2020 for COVID, I won't be where I am now with the work that we do. But you have to be consistent as much as possible and ensure that you get to engage the people who are in those platforms. If I'm expecting grant funding from, let's say, Global Health Canada, I'm waiting for global funding from WHO, and I've never engaged with their content or even what they share, I'll never know about it. So get consistent, engage with the platforms where you need that support and who can be able to help you get that what you need. And then also look at it from the point of, how is my idea contributing to their initiative? I can give an example of our collaboration with Health NGOs Network Kenya. Health NGOs Network is looking at how do they amplify NGOs and social, like the civil society organization work in the country in informing health policies in the country. As an organization, we are working with young people who are also NGOs and CSOs in the country, and we are now collating them, something that hasn't been done, and giving those inputs to their agenda so that at the end of the day, they're delivering value in what they intended to do, but they're using us as a medium to get to the people they never had access to. So what value are you giving them for them to invest in you and give you the financing you need? So those are some of the critical things that we also have to acknowledge. And it's not easy, it might never come as early as you expect, but definitely if you believe in your ideas, Eno mentioned, keep pushing. At one point, somebody will notice you and you'll derive value from what you're doing. Thank you.
Thank you for that. Francis, did you also want to touch on this question?
Yes, sure, thank you. So with misinformation, we've been able to work with our students and even in our community partners of the university. So since the service is actually part of the university, we are very much integrated and embedded in what the university does. So we have a community in a far-flung area, and they have very minimal resources, healthcare resources, and most of them, they usually use medications not supposedly being used for COVID-19 for pre-exposure prophylaxis. So right now, what we do is provide education by using different materials that they can read, so that they can actually um, understand what are the proper ways that they can do to actually help them during the pandemic. And it's actually very helpful. The service has been very helpful to let us know the magnitude of how much misinformation is actually um, rampant in the Philippines, because a lot of the questions are really about off-label use of medications, and these are readily available, and they can buy in actually more illegal settings in the country, and we try to combat that through specifically answer to one patient and providing information to the communities. We also post them through social media, and we partner with different student organizations in our college that provide this kind of service as well to communities. In terms of funding, um, when we started this service, because I think in the Philippines there aren't much that provide drug information service as what we do right now in our college. So there were a lot of pharmaceutical companies that actually talk to us to provide funding. So I think one of the most important ways to also look for funding is to make yourself be visible, talk to stakeholders that can actually benefit both sides, and also be open to the available funding opportunities, and also be available with people who would like to actually help your initiatives.
Thank you very much for that, Frances. Now, unfortunately, we do have to wrap up our question and answer session at this time. But if you do have any additional questions for the speakers, please contact one of our organizing committee team members, and we would be happy to put you in contact with one of the speakers, whoever you're looking to get in contact with. But thank you so much to all of our speakers for this session today. I really appreciate everything that you've put into this session. And I really appreciate the common theme and thread that we've had of collaboration over competition. I think that if we can all keep that in mind, we can really, really go far. So thank you again. I now have the pleasure of passing on to our closing ceremonies. I'll be passing along to the chair of Gwen, David Weekliam.
Good afternoon, everyone, or good afternoon it is from me, or whatever time of the day it is for you. You're very welcome to this is our final session. I was here yesterday at the opening, and that seems now a while ago. A lot has happened since. And now after a very, I think, full and rich conference, we're coming to the close. So in this final session, we'll have three presentations. Dr. Colleen Matter will present a summary of the 2 days. We'll have a video, and that will be from Jayatma Wickramanayake, who's the UN Youth Envoy. And then our final speaker will be Dia Satyani Samararsif, who's from the WHO Youth Council. So I'm hoping that Dr. Colleen Matter has joined at this point. I just don't see her there. And Colleen, are you there? I see Ave. Maybe you can.
Yes. Hi, David. Thank you. So as we all know, then health workers are often at work, and the same is also for Colleen currently. So she had an urgent case to work on. So I will be pitching in instead.
Okay, you're most welcome.
Thank you, David.
In that case, this is Eva Pold, and Eva is a key person for this conference, having been being the chair of the organizing committee, so a very important role. So Eva, you've been involved in this right through. So you also in a good position to, I think, reflect on the couple of days and how has it gone? What have been the key points?
Thank you, David. So indeed, these 2 days have passed very, very fast. And from the point of view of us, the organizers, everything has gone very well and completely as expected. So as I mentioned also yesterday, when we opened the conference, then we had more than 1,000 registrations. We have had very active attendees throughout all the sessions. Also, we did have a few interactive sessions, both earlier today and also yesterday, where different activities were conducted with our attendees, and also gathering their insights when it comes to both the panel sessions, the interactive sessions, but also even before within the registration forms has worked out very well. So perhaps the attendees can remember that when you were registering for this conference, then we were also asking several questions on policy recommendations on different areas. So part of our team worked throughout these days and these weeks, actually, going through the registration forms and reading through all of your inputs. And these are also some of the items that I would like to present with you hereby. So essentially, you, the attendees, wish that certain areas would be shared with key stakeholders in the future, and hopefully in the very near future. I will also explain what I mean by that very soon. So some key areas, some key recommendations that you brought out were related to mental and psychological health of young health workers. Then also inputs that we received talked about empowering youth to lead in the health sector and also provide further opportunities for engagement. This is also something that several of the speakers both today and yesterday mentioned when they were speaking about their respective areas. Might it be then digital health, might it be psychological safety, the pandemic. In essence, the empowerment of young individuals is key in everything that we have been discussing these past 2 days. Also echoing the theme, protect, invest together. So the theme of the Year of the Health and Care Worker. Several of you also mentioned that the importance of investing in training and also educational development is very important in order for young people to develop further in their career paths. In order to not burn out, also resources must be allocated, time must be allocated, and support must be allocated. This includes also mentoring young people. This includes also holding and keeping each other accountable when training future health professionals and also early career professionals. Something that also was mentioned in the registration forms and also in these sessions these past 2 days was the importance of creating platforms to exchange experiences. This is something that we also witnessed yesterday and today within the networking sessions. So all of you love to network, and this is completely understandable, because if we would not have the pandemic times, then we would be meeting together in one space, and the networking and the communication would potentially be much easier as well. And I do hope that these opportunities of networking that were provided to you on both of the days were something that you also find useful, looking into the future, but potentially maybe you could link with each other and also get some good ideas and insights from your colleagues and peers coming from all over the world. So what else was mentioned, and what have you been mentioning these past days, is perhaps adopting gender-sensitive policies and also creating gender-sensitive working environments. In addition, enhancing links between health systems, community needs, the job market. So being linked as a young either student or career professional to your future, to your community's needs, and also to the local context and the health systems. And perhaps I would wrap this part of the presentation up by saying that we need to ensure that that people are healthy, that people's health-centered needs are met, and also that health providers are respected and appreciated. So all of this are the words coming from you, dear attendees, and something that we will be undertaking soon. So in the upcoming months after this conference, so after today, the Youth Hub team will start working on analyzing all the inputs that you provided us, both during registration, also during the post-evaluation now that you will be sent, and also during the sessions, both interactive, both networking, and also panel sessions, Q&As, everything. And what we will be doing is putting together a call for action. So a call for action echoing what you as the young, let's say, future and current health workforce, what you are asking for, what you are asking from key stakeholders, potentially your governments, universities, your peers. This will be, of course, a call for action that will be then circulated beforehand with our partner organizations and key stakeholders. And then during the consecutive next months, together with the biggest and key youth health organizations, we will be putting together this call for action, and definitely circulating it also with all of you, and circulating it within then organizations who we are in close contact with. So maybe with these comments, I would hereby finish my overview of the conference. On behalf of the organizing team, we thank you very, very much for attending these 2 intense days. We do hope that you follow us on social media, that you join our email lists, and also that you share and potentially revisit the YouTube stream that you can see. So you can access all of the recordings. We will be sharing also afterwards some further information and resources related to specific sessions. And with this, David, I would hand it over to you. Thank you.
Thank you very much, Eva. I mean, as you reflected on the couple of days, it struck me that it wasn't a backward-looking summary, it was very much a forward-looking summary. And I think sometimes when we come to the end of a conference, it's good to remind ourselves that it's not the end, the journey continues. And I think you've pointed us in the ways ahead. And I hope that everyone who's participated has been motivated and challenged and learned something, and will want to move ahead positively, I think, from the conference. And I think you very much have put out there a call for all of us. And I think for all the young youth, students, young professionals, the role that all of you can play in advancing the health workforce agenda. And I think it's some of that is about issues that affect young people, young professionals, but I think it's about all the issues for the workforce. I think you have a role to play in all of them. And I think that's what you've challenged us there. So thank you very much for those remarks. So next we're going to have a video presentation. And this is from Jayatma Wikram Anayaki, who's the UN Youth Envoy. And this video is just going to cover some of the UN activities to support youth during the post-pandemic globally. It's also the role of global youth on the socioeconomic recovery from the COVID-19 pandemic, and how the UN Youth Envoy can support, through her mandate, the agenda of the Gwen Youth Hub, focusing on engaging and including youth-inclusive policy to drive the WHO Health Workforce Agenda. So, can we start the presentation?
Good morning, good afternoon, and good evening, everyone. I hope everyone who is joining us today is all in good health and good spirit, no matter where you are joining us from. Firstly, I'd like to thank the World Health Organization's Global Health Workforce Network Youth Hub for having me here today. More importantly, I'd like to thank you for hosting this important discussion on the youth workforce in the health and social care space. As you know, just a year ago, our whole world changed drastically because of the COVID-19 pandemic. Although the world is slowly recovering from this global health crisis, the reality today is most parts of the world are still hit severely by the impacts of COVID-19, and as always, healthcare workers are often the ones that carry the biggest burden in the front lines. Young health and care workers, including as well as young medical students, have been playing an active role in the COVID-19 response and recovery efforts around the world. However, they are more likely to face challenges such as burnout and inadequate support systems and networks. Undoubtedly, this can significantly impact their mental health and well-being. The world often praises young people as they are the beacon of hope. However, often forget that for this beacon to continuously soar, it must be supported and well-equipped. This is why the theme of today's discussion, Protect, Invest, Together, is particularly important. Protecting the youth workforce in the health and care sector is necessary to ensure the resilience of the healthcare sector and services. We need to invest in their protection, education, and capacity building so young healthcare workers can adapt to the dynamic challenges of the future of global health. It's also important to ensure that young health and care workers are engaged from the beginning in shaping the programs that will benefit them. Here at the United Nations, we believe in the power of young people. We believe in engaging young people as equal partners. When the UN Youth Strategy Youth 2030 was first launched 2.5 years ago, the principle of working with and for young people was at the foundation of this strategy and its implementation. Through this strategy, we hope to lead the entire UN system to be champions of meaningful youth engagement at all levels of their work and across all sectors, including on health and well-being. Just a few weeks ago, we launched the first ever progress report of this strategy, and from there we learned that the health sector is one of the top sectors where the United Nations country teams are providing support to governments with. I commend WHO for its continuous support to achieve this vision through the institution's leadership in engaging young people in health and care sectors by establishing, for an example, the WHO Youth Council and supporting youth-led networks such as the Global Health Network, Workforce Network Youth Hub. Lastly, before I end my thoughts, I hope that through the conversations you had here, you were able to discuss the post-pandemic future that you wish to see, as well as map out opportunities that will help you achieve this vision. Not only that, I hope you carry these conversations beyond this conference and to your work and to your daily life. I thank you once again for having me here, and I congratulate you once again for wrapping up such a great conference. Thank you.
Well, our thanks indeed to Jayatma Wikram Ayaki, the UN Youth Envoy, clearly playing a key role, and I think very much speaking to the need to protect our health workers, to value our health workers, and to engage young health workers for now and into the future. So we'll move on then to our next speaker, and that's Dia Satyani Samarasi, who's from the WHO Youth Council. And she's going to speak to us about the newly formed WHO Youth Council, including its aims and network, and speak about some of the linkages between the Youth Council and the Youth Hub of the Global Health Workforce Network, particularly in supporting the HRH agenda. So can I hand over to you, Dia, for your presentation? You're very welcome.
Thank you, David. And if I may share my screen for the slides, please. I can, okay. Thanks.
Please go ahead.
Hello, everyone. And let me first congratulate you, all the participants, and in particular the Youth Hub, for a very successful second conference. And this one is the virtual conference, I believe. Congratulations and thank you for having me here, meeting all of you today. So I'm asked to speak about the newly formed WHO Youth Council, and I would like to start from the very beginning. As you all know, WHO is driven by our global program of work, in which we said that we target to save 3 more billion lives during the course of this GPW 13. And that the 3 pillars of that aspirations are universal health coverage, health and well-being, and health emergencies. The foundation or the rationale of this GPW 13 is, of course, our constitution, the World Health Organization's constitution, and also the SDG 3, where we say that health for all people is fundamental to the attainment of peace and security and is independent on the fullest cooperation of individuals and states. So this GPW 13 is the rationale of the GPW 13 is this constitution and of course the SDG 3. Based on this, the Director General, Dr. Tedros, set out to set youth as the priority, the drivers of one of the key drivers to achieve the 3 billion goals. We always say that more than half of the planet consists of people under 30 years of age, and the young people's initiatives, work and expertise have actually highlighted much of the global health fora, and also beginning from the community level, at national level, regional level, into the global level, have highlighted many successes and become the drivers of success for health agenda. However, last year, we know that COVID hit, and we now have accounted up to the 6th of May, the COVID dashboard of WHO has counted for more than 3.2 million deaths. And now we are in the vaccination period where around the world we have counted more than 1.1 billion people being vaccinated as we speak. But this pandemic have also changed the course of how WHO, in particular in our subject today, youth, would like to express their eagerness, contribute expertise, become equal partners of WHO, and to harness this aspiration and also expertise. We go back again to the GPW 13 what the objective of GPW 13, where we would like to achieve to drive public health impact. So youth as one of the key drivers to achieve this public health impact despite the pandemic then becomes the reason why we have to have the Youth Council. This is to make sure, to ensure that the outreach of and involvement of young people within the WHO to advise WHO becomes has a systematic approach, and it is then being endorsed in WHO as a formalized group, and it has a formal mandate from WHO. We have the mission, vision, and goal and core principles mapped out in this slide. And the mission is to support and provide recommendations on key health and development issues affecting young people in particular. And then it is done through a comprehensive and inclusive youth engagement strategy, which will be one of the key output of the Youth Council. The vision and goal is to raise the profile of youth contribution to public health at global, regional, national, and local level, and to support WHO in its effort to strengthen youth contribution to public health system through advocacy and action. And this is to also drive global advocacy initiative that has a well-defined mandate and indicator. So this will formalize young people's contribution in within WHO to WHO. Core principle, it has to be inclusive and diverse. It needs to be transparent in all of its processes, and all of its activities are aligned with WHO's norms and standards. And its function is to facilitate coordination among the different parties to advance WHO priorities on the contribution of young people or youth to the public health agenda. The objectives of the Youth Council is laid out in this slide. It's to advance technical matters relating to youth contribution, fostering innovation, and whenever appropriate, foster new initiatives relating to youth and public health. Possibilities to engage youth in WHO governance process, provide recommendations on the elaboration and implementation of WHO youth engagement strategy, provide recommendations on strengthening youth involvement in WHO work, and strengthening networking, not only to strengthen but also to help build networking and knowledge sharing among different stakeholders in youth organizations. Membership, right now as we speak, we are preparing the infrastructure to ensure that inclusive membership can be done. The expression of the call for expression of interest will be issued in WHO Youth website, which will be embedded in WHO corporate website. This will fall under WHO initiatives. And it will be announced sometime very soon. And the WHO Youth Council membership consists of representatives from intergovernment organization, non-government organization, academic institution, private sector, including international or regional business association, philanthropic foundation, and it will be the private sector, including international association, will be represented by constituencies. The individuals, however, acting in personal capacity is not eligible for WHO Youth Council membership. This is a very simple chart that we draw out for this. Basically, the Secretariat will provide support, will ensure communication is done between the steering committee. There will be up to 5 working groups working on different topics to be discussed and agreed upon between the steering committee members and the working group members. Working group members are, of course, members of the WHO Youth Council later on. These are the, among other things, the roles and responsibilities of the Secretariat, where principally it will coordinate the meetings, oversee communication, chair the steering committee meetings, select and manage the council's membership in line with WHO rules and policy, coordinate between working group and steering group in ensuring that the communications are done between those three groups and also within and between the Youth Council and other departments of WHO. These are the steering committee, a bit of an explanation for the steering committee, where members are appointed by WHO. The selection process will strive for the balanced representation with respect to gender, age, geographical area, and organization type. And also it will be chaired by WHO, who may appoint one participant of the steering committee as the vice chair for a 2-year term. Membership, this was mentioned before, and now the part of the interlinkages with other WHO initiatives. The WHO Youth Council is designed to be an umbrella structure of different WHO and youth collaboration that are already ongoing. So this is to help strengthen all the different initiatives between WHO and youth organizations that already exist. We would like to discuss with later on the council members and also the steering committees how to best enhance the already ongoing initiatives. Each of the initiatives actually fall already being counted in WHO different dashboards and also with different WHO initiatives. So we would like to ensure that WHO youth engagement will contribute to the 3 billion target. We will make sure that it contributes, of course, to the pandemic response and also preparedness, and that it can contribute to different aspects and elements already ongoing within WHO at HQ level and also at regional level. For example, how perhaps the one of the working group theme can be how to ensure that data is being done and that youth are one of the drivers to ensure data transparency, accountability, and data is disaggregated by sex and gender, as we repeatedly ask our member states to do. That is just one example. Another example is actually pertaining to young people's role in strengthening the health system. You are health workforce that are right now giving health services to the public. Primary healthcare is the way out from the pandemic. Primary healthcare is the enabler to achieve universal health coverage. This is just to ensure that perhaps one of the working group perhaps will specifically address the role of young people in ensuring primary healthcare are strengthened and transformed in countries. I'm just giving example of what the Youth Council, the boundaries or the outreach of the Youth Council that the Youth Council can take on later on once it is formed. I think that is the last slide, and I would happily clarify in the clarification session if needed. Thank you.
Thank you very much. That was a really comprehensive and clear presentation of the Youth Council, and I think we can see how very clearly how the links with the Youth Hub in terms of contributing to the 3 billion. Particularly you've emphasizing kind of health systems and healthcare delivery. So I'm sure there's plenty more discussion to be had between you and members of the Youth Hub. So thank you very much for giving us that presentation. Now, a little bit earlier, Colleen Matter was unable to speak. She got called, I think, out on medical duty, and Ava Polt stepped in. But I see Colleen has arrived. So perhaps if I might invite Colleen, if she'd like to be put on the spot or not, and if she'd like to make any comments. In your absence, Colleen, Ave very kindly went ahead and gave us reflections on the couple of days and some good thoughts and I think inspiring action going forward. Would you like to add anything?
Yeah, no, thank you very much. And I heard from Ave. I am sorry I couldn't be here. I had planned, but I'm working in the emergency room. So obviously you cannot plan when you're working in the emergency room. And I was just wondering if I still had any blood on me. I don't think I do. So I want to very briefly just reflect, adding to what Ave, I think, probably very eloquently said. I think these 2 days of the Gwen Youth Hub conference have taken us to various different topics, reflecting on what can be done, what should be done, but also moving forward, we need to not only keep talking to each other, but to involve policymakers and people who currently have the power to decide what happens to young health workers for now and for the future. We certainly hope that with the advocacy of the Youth Hub, we are going to increase the contributions and give a seat at the table for young health workers in future health policy and planning. We are looking at a year where we're not yet halfway through. We still have 7 months to go, and we are hoping that we can continue all together working towards the goal of not only raising the profile of young health workers and health and care workers in general, but also making sure that whenever we are being brought up as the cornerstone of response and health systems response to the pandemic, but also not forgetting the day-to-day work that youth health and care workers do, we are not just in passing. We are considered as our own group with our own challenges that need to be addressed and should be addressed in order to not only help achieve the triple billion, but also fill the gap of 18 million health workers that I think we all know if we look again in a year, it will be bigger than that. So I think I just want to thank you, David, for joining us twice and for your contributions to Gwen, certainly your encouragement to the Youth Hub and being with us these 2 days. A big thank you from all the steering committee, and I know the Youth Hub members, to the organizing committee of this conference. Wonderful conference, very high level. I am very grateful for all the work that you put in, and certainly grateful for Ave's leadership of the team to get us there. I think I will stop here, and thank you for giving me the opportunity despite me being late.
Well, I'm delighted you managed to come back, and thank you for those remarks. Yeah, I mean, you've thanked various people there, and really I would just add my thanks to everyone who's been involved. I think it's been a great conference, and really thank you for those of you in the leadership that you've brought to the Youth Hub and the work that everybody's doing together. And thanks, big thanks to Ave and the team for the organizing. I think it's really gone exceptionally well. So a big thanks. And I mean, I think that the presentations, all the speakers, the panelists, and all of you participants, I think it's a big thanks to everyone. I think an event like this, it works well because of so many people being involved. So I think there's very little more really for me to say. I think we're not going to have a Q&A in this final session. I think we're Sorry, have I been on mute for the last couple of minutes? Do I need to start my closing remarks again?
No, David, we heard a little bit, but the final ones, yes, please.
Okay. Yeah, so the final thing is just to thank you all for for your participation. I don't know if you missed what I said earlier, but I just I'm sorry if I was on mute. But thank you to the organizers again, and to all the presenters, and to you for participating. So I wanted to wish you all a good day as we finish, to go well and stay safe, and to stay tuned to developments with the Youth Club, to listen in, and just to encourage all of you as you go forward to stay engaged and to be empowered and be active. And on that note, we'll close the conference. So goodbye, everyone.